And go.
Good morning. Finally, welcome to the May 26th Board of Supervisors meeting. And if you can, please stand, even though you're all on virtual, and we're going to do the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So how come I'm looking at Gary? Okay, Ms. Galva, is there any staff comments, or Ms. Turner? No staff comments this morning. Thank you. I'd like to move to item 1.
Item number 1 from the Administrative Office, receive a report from Mountain Valley EMS regarding RFP process for emergency medical services response for certain zones of the county.
Madam Chair and members of the board, I would like to introduce Mr. Lance Doyle with Mountain Valley EMS. He's presented before the board on this particular topic previously, and he does have an update for the board and public. And I see that Mr. Doyle is in fact in the meeting, so I'll turn it over to him.
Thank you. Good morning, Chairperson Callaway, members of the board, Ms. Edwards, and Mr. Alt. Thank you for allowing me to bring an update before this board. Again, my name is Lance Doyle. I'm the Executive Director of Mountain Valley EMS Agency. If you remember previously, we released a request for proposals for all 3 emergency response zones within Calaveras County. That would be the north and the south and the east. We did receive one proposal for the east zone from Ebbets Pass Fire Department. However, we did not receive any requests, or excuse me, any proposals for the north and the south zones. We have successfully developed a contract with Ebbets Pass Fire, which will be going to my board for final approval in a week and a half. However, we needed to retool the request for the original request for proposals to re-release for the north and the south zones. Again, because we did not have any proposals. Working with Endpoint EMS Consulting, they met multiple times with the current contractor, American Legion Ambulance, who had expressed interest in putting in a proposal, but ultimately did not. Through that, there were a number of key points and concerns that American Legion had expressed to Endpoint Communications. Those were similar concerns that were expressed to me in separate conversations. The long and the short of it is that what we were asking for in the new request for proposal, including the fine structures, the new mapping, the tiered response based on population density, the principal at American Legion felt that the requirements within the contract were not financially feasible for his company, and therefore he did not submit a proposal. Taking the input from American Legion, as well as some discussions with other interested ambulance providers, we went back to the drawing board, if you will, and updated a handful of pretty key items within the request for proposal. We worked with the leadership group at the county, which has been working on this request for proposal from the beginning, which consisted of 2 board members, as well as Mr. Alt and Kristen Stranger. And we came up with what we believe is going to be a much more competitive document. So the key changes that we made, all references to the East EOA have been removed from the contract or from the request for proposal. Again, because we've already awarded the east zone. We made updates to the mapping, prior mapping, which I presented to this board a couple months ago, really wasn't as granular as I think we needed. We were, the GIS consultant that we were using was blending the population density and thus not reflecting accurately, we felt, the rural and wilderness areas, which in turn was putting a response time of rural in a lot of the wilderness areas, which just is, those of us, we all live in the county understand that we can't have a rural response into a wilderness area. Some areas are just very hard to hit. So we went back and we redid the mapping, much more granular now, much more reflective of the actual population densities within the counties. We also amended our suburban and urban response times in certain areas of the county, specifically the urban response times. We were working off of a 11-minute and 59-second for a code 3 response, which is lights and sirens. Due to the geography of the county and where the population centers are, this would have made it difficult to hit, especially in the Highway 449 area, Copperopolis and Murphy's, within that 12 minutes. And then in addition, the Valley Springs out into Wallace area, that would be, if anything outside of the town of Wallace would be very difficult to hit. So we added 2 minutes to that urban response time to 13 minutes and 59 seconds, which we think is much more reasonable to be able to hit from the normal posting areas or the posting areas that would make sense for a proposer within the county. We actually lowered the response time in Copperopolis for the first responding fire agency, which is obviously Copperopolis Fire. If you remember, we're encouraging a partnership, if you will, with Copperopolis Fire for response into the Copper area. And we went from a 12-minute response time for Copper Fire to a 10-minute response time, which will actually bring ALS service to the citizens of Copper quicker than in the prior request for proposal, but then would also allow time for the ambulance provider to meet their response times within the Copper and the surrounding areas. Another change we made was we increased the allowable mileage on a 911 vehicle from 250,000 to 300,000 miles. In speaking with the current provider, because we put so many miles on the vehicles up here between the far reaches of the county and then transporting down to the valley fairly often, a lot of times they will run out of mileage before the lease is even up or before the vehicle is even paid for. So we extended to 300,000 miles, which we're all very comfortable with, given newer vehicles seem to be much more reliable, and the 250,000 has been in place for many, many years based on older technology of vehicles. We're actually using the 300,000 miles in a couple other counties as the cutoff. The liquidated damages, to help address some of the fiscal concerns, the liquidated damages were all lowered to bring them into in line with current response time fines, if you will. We went from, just as an example, $1,000 fine for every time the provider is out of compliance in a response zone to $500. So we, in effect, lowered everything by 50%. Again, that brings us a little bit more in line with what the current contract is. In addition to lowering the liquidated damages, we changed the way we calculate the liquidated damages. So response time compliance, which is your 14 minutes, 19 minutes, what have you, the standard that the provider has to meet, those will still be reported individually by urban, suburban, rural, and wilderness. So for public reporting, we still hold that compliance standard. which also would be held for a potential breach of contract, which hopefully would never need to get there. But in assessing the liquidated damages, we are consolidating all Code 3 calls for the North Zone into their percentile to potentially find the provider. And then we're also consolidating all of the Code 2, and then the same thing in the South Zone. So all urban, suburban, and rural calls will be rolled into one bucket, if you will, again, just for liquidated damages. And this will hopefully lower the amount of damages that a provider might be liable for, because again, usually in the urban areas and suburban, you're able to hit those times, but sometimes the rural areas, that far reaches, if you will, they're hard to reach. And so we help average those out, if you will. Another change we made is we clarified language relating to the first responder program in Copperopolis. Some of the feedback we got is that the way we had presented the program was unclear, and in turn seemed to be a much bigger financial burden than it was really intended to be. I think we've clarified that, so that hopefully that won't be an issue. And then lastly, we updated the insurance limits based on the rural nature of the county. We brought the insurance limits here in line with the limits that we have in our rural areas of Calaveras and Amador, and what our new limits will be in Mariposa counties. So that will be a cost savings. So with these 7 changes, we believe that the new request for proposal will attract some interest. We are prepared to release the RFP this week. It has been approved by the EMS authority. And then lastly, unless there's objections by this board, due to the almost 3-month delay that we have seen because of this COVID response, we will probably need to go back to American Legion and request another extension. If you're not aware, we are now in a 6-month extension through the end of December of this year. Originally, the contract termed July 1st. Again, because of the COVID response, we were prepared to release this request for proposal about 2.5 months ago. And then we got hit with the COVID response. In speaking with providers throughout the area, including American Legion, we just were all really overwhelmed with the response and preparation, and we felt it would be a poor time to release the document, and that we're not sure that we would get any, we would receive any proposals. In fact, a couple of the larger providers I spoke with said nationwide they are not responding to requests for proposals. So we put the RFP kind of in the drawer, if you will, and now that the COVID response, at least from a EMS perspective, the load has lightened and we're getting back to normal business, if you will, we think it's an appropriate time to release the document. But that being said, we lost about 3 months, and if we were to stick with our January 1st, 2021 implementation date, I think that's going to be too short. That only gives about 3 months for a provider to prepare and build their system. So I would like to offer another 3-month extension, which would bring us through March 1st. And that would give us a more appropriate timeline for providers to review the RFP, formulate a proposal, and then ultimately put together and implement the system. And other than that, that's all I have. Thank you, and I'm happy to entertain any questions.
Supervisor Tuffanelli, did you have anything you wanted to add to this?
Yes, thank you, Lance, for all the work you and your staff have done over the course of this time to get this prepared for us. I know it's a lot of work, especially having to go back after doing it the first time and not getting any responses. A couple of questions. One is, have you spoke to ALA about another extension? Are they in agreement with that?
I have not had a conversation. I would do that prior to us releasing the final timeline in the document. I have had general conversations with Mr. McNanny, and he's assured me that they are amenable to whatever it takes to get the RFP out, and he assured me that he is still very interested in remaining a part of the county. But that is a conversation that I would have with him probably today.
Okay, and the next question is, the RFP goes out this week. For how long will it be out there? Do you have a time frame, 90 days, 60 days?
I do. So if we were to release this week, I need to resubmit to the state just our new timeline for every time we make a change to the document, they want to have an amended approval. So I would resubmit to them today with our new timeline. We would have proposals due the first week of August. We would have oral presentations mid-August, which at this point would probably be remote, but we'll see where we are at that point. And then we would have an award to provider the first week of September. And this is where the timeline gets short. Normally, the industry standard is a 6-month, in larger areas, even a year-long implementation. Endpoint, our consultants and I agree that for a smaller county like this, a 6-month implementation would be fine, which would bring us to about mid-February, hence the need for the extension. September to basically December 31st, we feel could be construed. I'm not worried about our current provider. Obviously, they're already here, but we need to make sure that the request proposal we put out is fair for everybody. We don't want to put ourselves in a position where we would have a potential dispute down the road for a document that favored the incumbent provider.
And once we get a bid that's agreeable upon, that bid will be presented to, or that contract would be presented to the EMS board, Mountain Valley EMS board, and then will it come before this board for our acceptance?
So to answer your question, yes, the ultimate authority, if you will, for contract approval is with the Mountain Valley JPA board. I am happy to bring the contract and the elements back to this board. That would be at the pleasure of the board.
Okay, those are my questions. Thank you, Lance.
Thank you, Supervisor. Mr. Garamendi.
Thank you very much, Madam Chair. Thank you. Good morning, Lance.
Good morning.
Lance, and the 7 items that you listed that you were changing in the RFP, one of the things you were talking about was liquidated damages and that you're blending urban and rural response times in order to come up with that. I was hoping you could unpack that a little bit and tell me what that's going to mean for the rural areas. When you blend with areas that you could get to in 4 minutes, just if you could unpack that change for me and what that's going to materially mean to places, rural places that I represent.
You bet. Thank you. Great question. So the response time per zone, if you will, and what I mean by zone, just as a refresher, we have our urban zones, our suburban, our rural, and our wilderness. The response time to the individual zones will not change. The reporting of the response times for those individual zones will not change. Whether I'm reporting to this board, to my board, to the public, we put our response time compliance reporting on our website in all of our counties that we will have First Watch, which is our oversight software package, and we will be doing the same for Calaveras County. So the response times themselves and the public reporting will remain the same. So if you have a 19-minute and 59-second response time standard and you meet that, 91% of the time in, let's just say West Point, for instance, that remains intact, and that is what will be reported publicly. And ultimately, that is the standard that the provider would be held to for being in compliance with the contract. Where the blending comes in is strictly for the monetary penalty or the liquidated damages that the provider would need to pay. There seems to be a fair amount of concern in the county regarding how liquidated damages will affect the financial model, if you will, right? So we're going from a system that is based on self-reporting, if you will, for compliance, right? Which was the industry standard years ago. So the current provider sends a spreadsheet to the EMS agency and reports their response time compliance. We're going from that to a third-party monitoring industry standard where we are going to be, as the agency, reporting to the public, obviously, but the provider, what their response times are. And this is all based on validated data coming directly from the CAD and directly from their units when they respond on scene. So I think there's some uncertainty what that's going to look like. Not that the current provider has been anything but honest in their response time reporting, but it's a new system. I think there's concern, and in the prior RFP, there could have been a fine up to $6,000 or $8,000 for a response time period for, let's just say, a small rural zone that is very difficult to reach. That, a $6,000 or $8,000 fine is very significant. It'd have a huge detrimental impact to the finances of the county, if you will. So all we're proposing is to do, and we actually are doing this in our other rural counties now, is taking the urban, suburban, and rural responses and blending those together for the liquidated damages portion only.
Okay, I think I appreciate that response. I think that's straightforward. Obviously, my concern is obvious as well, insofar as I don't want, if we're blending together the penalties, I don't want them to say, the penalty is less than it would take for us to blow off that response time, because they average out. I think that's pretty clear. I'm sure you got your ear to the ground on that. It would just be, it's a concern that I have, and if you've got it covered, you've got it covered. But thank you.
I understand that, and just one other thing to keep in the back of our mind is ultimately a breach of contract is the hammer, if you will, and regardless of the response time penalties, there is language in the RFP and subsequently in the contracting that if a provider is chronically non-compliant, which in our world is 3 compliance periods in a row, and they haven't made adjustments to become compliant, then they're in breach of contract. So then we have other methods of enforcement, if you will, outside of the finances.
Thank you very much, Lance. Thank you, Madam Chair.
Mr. Mills.
Yes, good morning, Lance. I would like to acknowledge the highly qualified team with Endpoint and the work that they have done to help us get through this. I also am very appreciative of the fire districts and their wanting to go through this process and try to understand it as well. I think it'd be very valuable for this board to be aware when non-compliance issues are coming up or are happening, so that we at least have some pulse on it as well. But to be able to see the contract, I think would be a great idea for this board.
And I would like to bring, whether it's quarterly or semi-annually, a report to this board regarding contract compliance and really just an annual report. I think that would be a good thing.
Mr. Mills, are you done?
Sorry, I had to unmute. I'm done.
Oh, okay, thank you. I think Mr. Doyle will leave it to Supervisor Tuffanelli, who's our representative, to help whether the decision should be quarterly or semi-annually. Thank you. I do have a question. Do any of these changes impact the contract with Ebbets Pass Fire District?
That's a great question. Actually, Ebbets Pass Fire District was they have benefited from the changes that we made. I was a little bit concerned with that issue because they responded to an RFP with some stricter guidelines. In conversations with Mountain Valley's council, we were under agreement, and he is comfortable that we were able to roll the changes in the new RFP into the contract with Ebbets Pass Fire. So they were beneficiaries of these changes.
Are there any other board questions or comments? Otherwise, I'll open it up to the public for any public comment on this issue.
Caller with the last four digits of 1748.
This is Cissy. I'm not commenting on this issue. I was waiting to hear on the COVID update.
Okay. Caller with the last four digits of 4541. You're live with the Board of Supervisors, and you can make your comment now.
Hi, I'm calling in for the Risky Slide project. I'm the
last four digits are
consultant.
4541 of your phone number. You can
Hello.
make your comment now.
Can you hear me? Hello? 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 Can you hear me?
Caller, this is Jack Garamendi. I can hear you.
Oh, I'm calling about the Risky Slide project. I'm the environmental consultant for that one, so no comment
Okay.
here.
That's not the comment for this item. So I think just stand by. And I think we'll figure out what's going on here.
Yes, I don't think I requested comment. I'm not sure.
Okay.
I'm unmuted. Hello. To all of you, I apologize. If someone has a comment on this item and we could not hear you, if you could try again calling in, we will make sure that we get your comment. Thank you. Because I've been moving so fast, I would like to go back to staff comments. Health and Human Services does have a staff comment to make.
Laura, you're on mute.
So sorry, I've been waiting and I forgot to turn myself off of mute. Good morning, Calaveras County, and good morning, Board of Supervisors. I'm Laura Larson, the Deputy Director of Social Services. Imagine for a moment, if you can, county helping agencies taking an upstream approach to help to support families and children before they find themselves in a crisis. I would like to introduce you to the Calaveras County Care Team, an innovative way of identifying families in need and taking an upstream approach to supporting them. For several years, Captain Eustace, Director of Student Support Services, County Office of Education, envisioned a program where children and families were supported before they were in crisis. It was Catherine's vision that brought together several helping agencies to develop such a program. There were several agencies and professionals involved in the development of this program, all of which remain a member of the CARE Team Steering Committee. But it's important to mention Catherine's commitment to this program, not only behind the scenes, but because of the work that she does with the CARE Team. She facilitates meetings. She's a note taker, and she's a chair of the steering committee. She never wavers in her commitment to the children and the families we serve. I would like to thank Catherine today and every day for the work that she does with this particular program. With that, I would also like to thank all of the agency representatives who are also committed to the development of this program and continue to support children and families as our program grows. Several of these folks are here today, and I would like for them to introduce themselves and the agencies they represent. And I would also like Catherine to provide a short narrative regarding the Calaveras County Care Team. And with that, I would like to thank you all for your time. Kath, introduction?
Oh, it's gone.
Hello, Catherine? Care Team?
I think you're by yourself.
Okay. Well, with that, I would like to share.
Catherine's on. Catherine, just unmute yourself, please.
Okay. Okay.
Beautiful.
Can you hear me?
Yes, and turn your video on.
I don't know how. Where do I do that?
At the
Don't
bottom.
worry. Verbal is fine.
Okay. But you can hear me now?
Yes, Catherine, we can.
Okay. So first I want to say thank you, Laura, but that's not true. You guys know that everything I do is just manifesting community vision, and this is another one of those situations. The Calaveras Crisis Collaborative, the one that invented all of the countywide crisis protocols, and Health and Human Services, who have been absolutely steadfast partners in helping us rebuild the continuum of services for student mental health, are the ones who came up with this idea to go upstream and to build the care team. And I'm just the legs, as I am with all of the things that I've done. So thank you so much, Laura, but really, credit is due to the people who are doing the work. I'm just the legs. Laura had wanted me to let you know who's on the team, because I'm not sure if everybody is on this call, but we kept it a really small core team, and then invite in a lot of other agencies as needed for the families that we're serving. So the core team is Laura Larson from Health and Human Services, Colleen Rodriguez from Public Health, Janine Schumann from the County Office of Education, Celeste Mata from the Calaveras Crisis Center, Cindy Lopez from Behavioral Health, and Terry Lane from First Five. And we get together monthly and accept referrals of families and students who are in need of a more collaborative approach to the issues that their student is facing. We've been working this spring on building out the student mental health section of the County Office of Education website. And on there, you will find a more comprehensive description of what the care team is and does. I know you guys probably have a full morning of meetings. So I just wanted to let you know that overall, our goal is to develop a unified approach to and understanding of families' needs who have more complex needs in our community, and help them to access resources themselves and help our agencies to support them more efficiently and more effectively. Are you still there, Laura?
I am. Thank you so much for that description, Catherine. It's been a wonderful opportunity working with all the different agencies to bring together this particular program. And our hope is that by having an upstream approach in supporting families, we'll find less families coming into the mental health crisis center, or maybe even coming to the attention of child welfare or probation. So our hope is that it will have a future effect on families to support them before they get to a place where we have to step in with more formal support. So thank you all for your time.
I do want to thank you, Ms. Larson. Thank you very much. And for Ms. Eustace, I've known her for years, and she is a Calaveras icon when it comes to services and being creative on doing things for children. So having her as part of your team is a win for you and
Absolutely.
the county. Thank you very much.
Thank you.
Okay. There's no other staff comments. I was going through. Fine, thank you. I'd like to move to item 2, which is an update presentation from staff on the COVID-19. And I'll turn this over to Mrs. Stranger and Dr. Kaleda.
Good morning. This is Dr. Kaleda. My audio was a little choppy last time. I'm prepared to dial in if necessary, so let me know if you can't hear me properly. Calaveras COVID-19 report for May 26, 2020. The U.S. is pushing against 100,000 coronavirus deaths. As of today, there's 94,500 cases of COVID-19 infection in California, with 3,795 deaths. Calaveras County now has a 14th confirmed case. This most recent case was reported on Saturday, May 23rd, in an adult male residing in the upper Highway 4 corridor region of Calaveras County. Public health staff will continue to investigate this new case to determine any possible persons who may have had close contact with this positive individual. Close contacts will be assessed and monitored for signs and symptoms of COVID-19 illness. The source of infection for this new case remains unknown at this time. Mark Twain Medical Center has been able to resume non-emergency elective procedures such as cancer treatment, cancer screening tests, orthopedic surgeries. Our healthcare system retains enough hospital beds, ICU space, ventilator capacity, and PPE to care for a surge of coronavirus patients if needed. Nursing homes across America are home to less than 0.5% of our population, yet account for over 1/3 of all coronavirus deaths. Avalon Nursing Home in San Andreas has undergone a complete coronavirus testing of all of its residents and all of its staff who care for them. All these results have come back negative, indicating the facility remains free of COVID-19 disease. Protecting the lives of our high-risk seniors remains one of my most important priorities. As people are aware, Calaveras, the state of California accepted Calaveras County's attestation to be granted a variance to move further along into stage 2 of the governor's 4-stage pandemic roadmap to reopening. This variance was granted to our county because we've demonstrated low enough rates of coronavirus infection, the ability to track and contact trace any new cases to interrupt local disease transmission, and we have the capacity to test 1.5 per 1,000 of our residents every day for COVID-19 illness and ensure the hospital has enough space, equipment, and PPE to respond to a resurgence of disease if it comes. To improve and expand our ability to provide testing to our population, our community has been chosen to receive an OptumServe testing site. This is a dedicated state-funded testing site for COVID-19 PCR molecular testing that will be located at the Calaveras County Frogtown Fairgrounds in Angels Camp. Once the appropriate agreements and protocols are in place, our goal is to have this testing site operational by this Friday, May 29th. Information on how the public can schedule testing appointments will be posted on our website, including an internet-based process and a 800 free telephone number. Once fully operational, the OptumServe site will be able to accommodate up to 140 persons a day. Because of the approval of our local variants, many local Calaveras businesses are now able to resume activities such as in-restaurant dining and in-store shopping, as long as the businesses comply with infection prevention safety plans. These plans require continuing social distancing and disinfection procedures, which have shown to reduce the spread of the virus among their employees and customers. New guidance has also just been released by the state, allowing for counties such as Calaveras, who've been granted this variance, that moves hair salons and barber shops, churches and houses of worship, and all retail shopping into the enhanced stage 2 category of allowable activities. Again, specific infection control procedures, physical distancing guidelines, and employee training requirements will also need to be implemented. So now people can get their hair cut. Churches can resume in-person worship services at 25% of their building occupancy up to 100 attendees. Weddings are still not permitted. Funerals already have specific guidelines. Additional in-person services provided by religious organizations such as counseling services, AA, and other 12-step programs are also now allowable. Day camp guidance should be released later this week. The public is still highly recommended and encouraged to wear face coverings when in public and near others. Mass gatherings and other large-scale venues such as concerts, conventions, sporting events remain closed at this time. The governor will announce further expansion of allowable business and recreational activities according to stages 3 and 4 of the state's roadmap to recovery if the COVID-19 pandemic continues to improve and stabilize. Public Health has worked with the school districts to allow for and design drive-through graduation ceremonies to recognize the hard work of our graduating students. In addition to the public, the frontline soldiers against coronavirus are our doctors, nurses, EMTs, and other local health officials. The health system exists in local hospitals, not federal agencies. Avalon Skilled Nursing Facility is home to our greatest generation that fought and won the great wars of the 20th century. We owe it to them, as well as our other high-risk neighbors, to remain vigilant and protective of their lives and safety. This pandemic is by no means over. Using the baseball analogy I like to use, we're currently in the 3rd inning of a 9-inning game. This crisis is going to remain with us until there's an effective vaccine available to provide protection to the entire public. So it's up to us to keep our own communities safe. Further information, including more specifics on the Frogtown testing site, will continue to be put out by Public Health. I can hold questions, or Ms. Stranger is also available to discuss some more specifics of the new guidelines that the state has issued to allow for hair, churches and houses of worships, and expanded shopping opportunities as well.
Good morning. Thank you. This is Kristen Stranger, Health and Human Services Agency. So over the weekend, as Dr. Kaleda mentioned, Public Health received word from the state that additional industries and sectors are being moved from stage 3 to stage 2 as part of the gradual reopening process, not only for variance counties, but also statewide for some certain industries or sectors themselves. The state announced a statewide reopening of places of worship for religious services and in-store retail with modifications. That guidance is already available on the state webpage, which can also be linked to from our local our local Roadmap to Recovery COVID-19 page. We have done direct links to that industry guidance there. The vast majority of large-scale gatherings remain prohibited under the state's stay-at-home order, but guidelines have been released for in-person protests and events designed for political expression. The guidance, as Dr. Kaleda foreshadowed, specifically speaks to modified occupancy at a rate of 25% of the area's max occupancy, or a maximum of 100 individuals. Again, there's many specifications, and depending on the individual situation, that guidance is meant to address those individual situations. For variance counties, barbershops and hair salons will be allowed, and you'll be hearing more of this likely from the governor in his announcement today or tomorrow. That will allow for barbershops and hair salons to reopen for haircuts and hair treatments only. So that does not include facials or eyebrow waxing or any sort of measures that are more direct contact. That information, again, when it is made available, I looked this morning on the state's website, the guidance was not there yet, but when it is, we will be able to share that as well. I think it's important to note that when Calaveras County prepared its attestation, which is posted and received by the state, we wrote in their specific language that said, anytime a sector or industry is moved in to stage 2, we would follow along with that guidance. So as you start to see information coming from the state that says things like, this industry or sector can provide service so long as the local health department approves it and it's moved to stage 2, I wanted this board and the community to be aware that we provided in our attestation the flexibility to go forward, meaning, for instance, barbershops and salons are being added into stage 2. There's no additional measures that Calaveras Public Health needs to take to allow that to happen. We foreshadowed the expansion of these industries going into the stage 2 category, and we've allowed for that flexibility so that the community can go into it on its own, so long as those modifications are put into place. We will continue to utilize our COVID-19 webpage. We have a Roadmap to Recovery tab that has updated information on it as quickly as we possibly can, because this is a moving situation. We will continue to use our webpage, press releases, videos, partnerships with Chamber of Commerce and County Economic Development to communicate this information to the public, as well as receive the calls to the public health line, which we are doing and responding to. In addition, we have a number of items that have been moving forward in partnership with not only the county, but other local community partners. And one I wanted to make the board and the community aware of is that a virtual local assistance center, which provides a place for individuals and families and businesses can access services and programs that might be available to them. So the resource center, the virtual local assistance center is the brainchild of pulling together a number of community partners in order to make these resources available in a one-stop shop. This is a local assistance center was put in place after the Butte fire and was extremely effective in terms of connecting community members to the resources that they needed in order to move forward in the rebuilding process. So this is modeled after that same local assistance center process, except for, of course, this time it's needing to be virtual. So the first virtual local assistance center is going to be targeted at older adults and people with chronic medical conditions. We have flyers that are available that we've been making available throughout the community. The day for that is Friday, May 29th from 9 a.m. to 11 a.m. All of this information will be recorded. The partner presentations will be recorded, and all the questions and answers will be recorded. So if individual community members would like to access this information at a later time, they can do so. Resources to support individuals, community members, as well as businesses and other entities, such as how to access services and resources for utilities, transportation, food assistance, financial assistance, mental health support, etc. These are the types of information that you will be able to find on these virtual local assistance center presentations. Again, we will be pushing this information throughout the remainder of this week to make our community informed of this, and we will do a number of virtual local assistance center presentations targeting various groups. I also wanted to make the community and the board aware of individual partnerships. Kathy Galino is on the line, and she'll cover this a little bit more in detail to round out the formal presentation from on COVID-19. But personal protective equipment, which is a necessity for businesses that are part of stage 2 reopening to be allowed to operate. We have worked together, the county has worked together with the local Chamber of Commerce to ensure that PPE can be available to business owners through a partnership with the Chamber. Gloves, face coverings, and hand sanitizer are available to local business owners free of charge while they await their orders, because as you know, and we've said multiple times, PPE is at a premium, and sometimes there's a delayed ability to obtain those supplies. This is a way to provide a stopgap to be able to help those businesses come online as quickly as possible in a safe manner. So if individuals are interested, there's flyers that have been provided via social media and on websites and such, but they can reach out to the Chamber of Commerce at 209-754-5400. And also, the Chamber has been working in partnership as well to make sure that they are putting information out about how businesses can access PPE, personal protective equipment, from local providers, who has it here locally and how they can access it. So that information has been streamlined and shared widely throughout the community as well. Dr. Kaleda did touch upon this testing website, or excuse me, the new testing facility is a partnership of Tuolumne County and Calaveras County coming together for the state to operate a OptumServe test site. That will begin effective Friday, May 29th. Again, I just wanted to plug that for an opportunity. And with that, I'm going to toss this next part of the presentation to Kathy Galino, who can provide a small update on the work that's been being done by all partners to come together to support businesses in their reopening process.
Thank you, Mrs. Stranger.
Good morning, Chair and Honorable Board. This is Kathy Galino here. Thank you for a bit of your time. So we've been working very collaboratively with the City of Angels Camp, Public Health, County Chamber of Commerce, and my office, as well as other business leaders. On Friday the 15th, we actually did 2 webinars. One that was unpacking the state's guidance on cleaning and operating for restaurants. We've had about 75 participants via the live webinar, as well as all of our webinars are recorded on YouTube. So there's been a lot of interaction there. Later on the Friday the 15th, we also did one for the retail industry. This one we had well over 75 participants. We were trying to get out ahead of the businesses actually opening so that they were prepared and had their PPE, that they had their social distancing identified, and any cleaning supplies that they needed. They were really super successful. On the 19th, we did another one for the real estate industry. They had some pretty good guidance through their association, but they're really thankful to have a local support network. And just going forward, we have one coming up, actually 2 coming up this Wednesday at 1 p.m. That's actually tomorrow. Oh my. We have hair salons and barbers, where we will be unpacking the state's guidance and getting that industry sector together and ready to open safely. And then at 4 o'clock tomorrow afternoon, we have the health and fitness. That is not yet in phase 2, but we're trying to be out ahead of where we think phase 3 will be coming in and applying to Calaveras County. So, and then Friday, the 29th, we're going to be looking at the lodging industry. So we're being very aggressive, trying to get this information out and get these businesses ready and identifying any support that they need. Any questions?
Are there any questions from the board at this time? Of Kathy? Are there any questions from the board or comments to Dr. Kaleda or Mrs. Stranger? Are there any? Mr. Stopper, do you have any? I see your hand up and down.
Just waving at you, Marita. Go on and let Mr. Toffanelli go.
Okay. Mr. Toffanelli?
Yes, I do. It's either to Dr. Kaleda or Kristen. Was there any mention on any of the presentations by the governor about gymnasiums being open?
Not at this time, Supervisor Toffanelli. That question was specifically asked, but we have not received any guidance about the timeline for gymnasiums as they remain as not allowed to be in stage 2 yet. But of course, as soon as we receive that information, we will make it known.
Thank you.
Any other supervisor comments? I have some. Mrs. Stranger, when they allow the hair salons open, does that also include nail salons?
So I do not believe so, Supervisor Callaway. The way the guidance is reading thus far, again, it's not quite out yet. This is just preliminary information we learned over the weekend. It would be limited to hair salons and barber shops specifically for haircuts and hair treatments. That is the only guidance we've received thus far.
Oh, so our governor is going to get his haircut. All right. At what point, when the guidelines are out, which could be this afternoon or tomorrow, would the barber shops and hair salons be able to open as soon as those guidelines are out?
My response to that, Supervisor Callaway, would be as soon as that they've prepared and been able to operate their businesses within those guidelines that are yet to be released, they would be allowed to reopen. Again, this speaks a little bit to my point earlier today about when we prepared the attestation, we had said anytime an industry comes into stage 2 or is considered allowable to reopen as part of stage 2, the public health would not need to take additional bureaucratic steps to allow that industry to go forward. They would be allowed to operate as soon as that guidance is out and as soon as they have the proper measures in place to operate within those guidelines.
Okay. If you could somehow check through your sources when nail salons might be included, because there is a physical separation during that activity. I'd appreciate that. Are there any public comments on this, please?
Supervisor Callaway, do you think I can?
Yes.
I want to I have a quick question.
Yes,
All right.
Supervisor.
It's not about my nail salon either, although.
Is it your haircut or lack thereof?
Kristen, we are putting out guidance, and just so I'm clear, so once it posts up on the state and we put it on our website, there's no further steps. My nail salon doesn't need to go check in with the county to start work if they're doing it correctly. Are we going to be posting guidance on places of worship and churches as well, so that they understand what the guidance is, and same thing?
Yes, Supervisor Garamendi, it's actually up right now. We were able to do the link this morning on our webpage. We are updating. We're actually in the process right now of making modifications to our webpage to make that guidance more easily accessible, but it is currently up there. And again, I would urge the public to go to the Roadmap to Recovery tab on our COVID-19 webpage, as well as the businesses web tab on the COVID-19 webpage. We have FAQs that are being updated regularly, and that's where you can find all of the information. And a lot of it does link directly back to the state's webpage, which has the direct guidance for those industries. And that is largely because Calaveras Public Health is not issuing additional guidance that needs to be followed for our local businesses. We are deferring to that guidance that is made available on the state's website, and that's where it will be limited. And businesses do not need to check in with us prior to opening, share with us their plans. We know that our businesses are wonderful community members and are taking this very seriously. We know because we field a lot of questions from them. And so we urge them to reopen under those modifications and call us if they have any technical assistance questions.
Thank you. I'll be sure to call my local hair salon and get my reservation. Thank you.
Thank you, Supervisor. I have one letter that came to the board that we believe it's under this topic versus general public comment. So I am going to read this into the letter. It's from Kim Skeen in District 2. The state of California is great in most ways, but has gone downhill so fast it's mind-boggling. When will you, our representatives, stand up for our constitutional rights that you swore to uphold and protect? People are hurting. People are losing all they have worked for, and our constitutional rights are continuously being trampled upon. Where are the Patrick Henrys of our day who have the courage to stand up to the tyranny that has come to our land? What started as an act to not overwhelm the hospitals and to flatten the curve has now turned into something completely different and is the embodiment of the saying, never let a good crisis go to waste. How long are you going to play into these unreasonable and unconstitutional rules that completely lack the common sense and infringe on our rights? What was meant as temporary measures should not be allowed to drag on for this long. You have more power than you think. Other California counties and cities seem to understand this fact, but you're allowing yourselves to be counseled against taking action to open the county. People who are still scared can stay home. Allow us to be American citizens who can decide for ourselves. We've been doing just fine since 1776. Thank you for this. Are there any phone calls waiting to comment on this? 4541. Hello? We're someone on the line? I'll come back to you in a moment. Do we have another one? Please.
Hi, this is Sissy Hedrick.
Oh,
Hi,
okay.
this is Sissy Hedrick. Hey, Marita, how are you?
Hi, Sissy.
I'm excited and I'm sad all at the same time because so many of my partners in my industry are manicurists, estheticians, and they are needing to get back to work. And I really hope that we can get them moved farther along faster. I'm not quite sure why they're not in the same boat, because they can wear masks. We already take so many precautions in our sanitizing practices that are governed by the State Board of California, and they deserve to be open too. With that being said, I have a comment on the high school. I want to understand, Dr. Kaleda, why can't you allow the high school students on the football field and only allow maybe their parents in the stands? The class isn't that large. The stands are huge and the field is huge. And you could totally do social distancing and give these kids an opportunity to stand on their football field one last time before they are out of high school. It makes me want to cry for them that you're going to make them sit in a car and drive through a line with their parents in the car. It's just, I find that ridiculous, and I don't know what else to say about it, but please reconsider that. All the friends and families don't need to go, but at least if their parents are there and these students can be on the field and get their picture taken one last time on their football field, don't you think that would really make a big difference? They've been in social isolation long enough. They need to be able to walk on their campus one more time. Thank you.
Thank you, Sissy. I don't disagree, which is why I asked Mrs. Stranger to kind of lobby on our behalf when she talks to the state. Dr. Kaleda or Mrs. Stranger, do you want to answer the question in relation to the schools? That would be both Bret Harte. I am a Bret Harte mom, so be careful what you say. And Calaveras High School and Mountain Oaks. Thank you.
Yeah, I can address that. I understand that it's frustrating not to be able to recognize our graduating students who've worked so hard to get to where they are. But mass gatherings are specifically a very high risk activity. In fact, most outbreaks have been traced back to gatherings of people in high density at high numbers. And so unfortunately, mass gatherings are specifically the type of activity that we want to be very careful about and are prohibited explicitly at this time under our stage 2 reopening things.
Thank you, Dr. Kaleda. Do we have another one? Another call? Is the person on 4541 there? Clerk, are there any other calls waiting? Okay. Oh, okay. Okay. Thank you. I'm going to move on to the next agenda item. Dr. Kaleda, Ms. Stranger, thank you very much for the presentation. It's a step. Oh, wait a minute. I do have one. On RV camping, and I know I've broached this before through emails. If you have an RV, which is a self-contained unit, can you not go into an RV campground, assuming the campground keeps the RVs at a social distance or so much difference between the RVs. And I know the rule is stay at home, no leisure travel, but we've had issues, not saying issues so much as challenges with second homeowners. And if you have an RV that you've leased the land for a year, that's to me the same as a second home. Are we still saying no to those? So the question's two parts. Thank you.
In general terms, camping is considered an overnight lodging and leisure activity, and as such is not permitted under the governor's current stay-at-home order.
So, Dr. Kaleda, when the Forest Service opens up and the Bureau of Reclamation open up camping, and it's of course mostly impacts the Ebbets Pass corridor and possibly, and then Maloney's Supervisor Mills's area, will we then allow camping in those commercial campgrounds?
Well, my understanding is that we are bound by the laws of the state of California, and during the governor's stay-at-home order that forbids overnight lodging and leisure travel activity, that applies to overnight camping.
Okay, thank you. I appreciate that. All right. I want to move to the next item, which is a board consideration for terminating the declaration of a local health emergency. I will ask our CAO, Mr. Alt, to introduce it, and then I am going to turn the meeting over to Supervisor Mills, whose item this is. Mr. Alt.
Just a real quick introduction. This is on the agenda at the request of supervisors. The item, as you know, for the local declaration for this particular item, the local health emergency does require at some point for the board to take action to terminate it. We don't have to continue to take action to extend it based on the governor's exception for this particular order. And so at some point, the board will have to consider termination of the item as we move out of the current emergency. Madam Chair, you're muted.
Don't get so excited, everybody. Mr. Mills, I'm going to turn this meeting over to you.
Thank you, Madam Chair, and also to CAO Alt for putting something on the agenda regarding the board's discussion. The governor has repeated over and over again of the need for the County Board of Supervisors to have conversations regarding this issue. That doesn't mean receive presentations. That means that they actually go into some very detailed, long-winded conversations. I've looked at the agendas for other boards of supervisors, the level of conversations they've had. Many have been aware of the 12 hours of meetings that occurred at Riverside here within the last month. But the thing that has driven this is the board needs to and is expected to be an integral part of this process. That being said, when we ratified that local declaration of emergency on March 17th, there was some substantive statements regarding what the situation was going to be and the projections for that those situations. We heard an average of 60 to 122 cases in the 4 to 6 weeks after that period, and on May 1st, that did not occur. I'm very concerned because when you declare an emergency under Government Code 8558 about extreme peril, that the local emergency states in subsection C as defining as beyond the control of local resources. That's why we developed this type of an action. Now, health and safety in 120210 does not speak to non-infected people. There is a due process to prove a case is contagious, and there is nothing in the code regarding asymptomatic or people who are healthy. So we've taken a very extreme step here, and it has not panned out. I refer to what Sheriff Chad Bianco of Riverside County said is the original projections and fears caused the order to be put into place in the first place have proven to be wrong. Any steps other than to rescind this kind of activity is a direct attack on basic rights and sets us apart from being the greatest country in the world. Now, in California in 2018, Seasonal flu accounted for 7,000 fatalities. Where are we now with this? We're at 3795 is the last report. The national numbers are all being revised downward. The mortality rate is 0.03%, the same as seasonal flu. I'm very concerned. We put together those 30 beds at Calaveras High. I don't think any of them have been used. We've had no hospitalizations. And I refer to what happened in New York, and I think in some degree California, is nursing homes have spiked by a decision to house patients in those facilities. I do have a question about, are we testing the right people? With random testing, you don't really, without it, random testing, you really don't know where the virus is. In the U.S., 13% of all tests are coming back positive. I'd like to know what percentage of those tests tested in Calaveras are coming back positive. Who's getting tested and how? If the focus is one of symptoms are present, then it makes sense a larger number of people will test positive. This is called a reactive testing model. And only random testing would provide the data set to show the level of infection in the general population. 600 doctors nationally have now saying that the health effects of the lockdown could be considered a mass casualty incident. And Calaveras has not applied the same rules to every business. We're not seeing community spread in Lowe's and Sonora or any grocery store. You ought to have seen their parking lots during the lockdowns. Our local lakes this last weekend have just been overwhelmed. You go to natural bridges, you find out just exactly what's going on with that. So statistics throughout the U.S. show counties that have locked down have actually done worse with the virus than those that have remained open or partially open. When we are reporting cases, we're not seeing the other ailments that could have just as likely been the cause. We're not seeing the severity of those cases or the underlying factors that could have contributed to the testing positive. I understand that these tests are looking for broken RNA chains, but there's no justification for any lockdown where there is no health emergency in our county. What are the facts that support the findings? The premise that we would see that average of 60 to 122 cases in the 4 to 6 weeks of from March 17th did not materialize. We have not needed the 30-bed location at Calaveras High. We have no fatalities, now 14 cases. How do these numbers stack against the normal seasonal influenza? And is there a possibility we're not even reporting flu cases right now? The initial estimates were predicted on a model that has proven to be inaccurate. And now that the real data is in the system, it's like we were predicting a tornado and it missed us. I do not see the justification that our local system will be overwhelmed. Therefore, there is no need to keep a local emergency in place. I would really question is how much have we spent on this local health emergency in total, and how much have we committed to in contracts? And if we expect the state, who is $54 billion in a hole, according to their own statements, how are they going to be able to fund anything without federal intervention? The promises of state reimbursement is questionable. The state doesn't have the money, and it will depend on loans from the federal government, who may refuse some of it if we continue to give money to illegals or do other activities of that type. So unless this is really about the numbers or ability to contain it, maybe it's more about the money and the control. Our local system's not overwhelmed. We're not in a state of emergency as defined by Government Code 8558. And I would like the board to have a serious discussion on whether or not to continue a state of emergency that just hasn't borne itself out. And I'll leave it with that.
Thank you, Mr. Mills. I think we're going to need some information from staff members. Mr. Mills did ask about how much we spent. I don't know if Mr. Osborne's on the line.
Madam Chair, I am here.
Can you answer that question or the comment and what that would mean to us if we terminate this order?
Yes, ma'am. As of about 8:51 this morning, our total cost for this event is $579,207.28. The caveat to that is we are estimating about $13,348.41 in labor that we haven't seen the time cards yet for. The time period ended Friday, and yesterday being a holiday, we haven't received all of the folks that are involved with COVID, the timesheets come in yet. So there's a small margin of estimation in that. And in preparation for this discussion that I reached out to the Cal OES Recovery Group and spoke with them regarding what may be the downstream effects of either continuing or not continuing the local health emergency, and learned that if we decided to be illustrative, if we decided to terminate the local health emergency today, anything that we spent from today forward would unlikely be reimbursed by FEMA under the public assistance program that we have been granted, we have applied and been granted public assistance for. That would include any PPE supplies, which our PPE supply replacement is right $103,712.77. So there's our total, and there would be the downstream effects that I'm aware of handling that today.
Mr. Osborne, are you saying that we would still be eligible for the $580,000, including the 103 PPE? I wasn't clear on that.
So what would happen if we terminated it from this date? Anything after today would likely be ineligible under the public assistance program. To date, we have spent that $579,000 and change, including the $103,000. So it is likely that would be a part of our local health emergency, or not likely, it is. And it is likely that would be reimbursable under the public assistance declaration that the president issued for COVID-19.
And if we terminated it, would the EOC shop close down?
No, ma'am. We are operating at a level 2, which is not full, but not the lowest step. It's right in the middle. And we would continue to do that and support both public health and economic development, since they both are in integral parts of our recovery. We would continue to support them through our EOC until we actually closed the EOC and considered ourselves post-event.
Okay, and the testing site at Frogtown, what would the impact be to that?
So the testing site at Frogtown is being provided by the state, and I would ask Ms. Stranger to provide a little bit more of an overview on that, since she's partnering with the CDPH on that.
Good morning, excuse me. Christian Stranger, Health and Human Services. So John is correct. The OptumServe site is primarily staffed by the state. That being through the OptumServe contract, the state contract that we've heard about. That being said, Calaveras Public Health as well as Tuolumne Public Health have been integral partners in terms of operationalizing it. So there is staff time going into currently getting it prepared, getting it off the ground, materials, preparations and such. So that is the response to that question.
Well, it's not really. The question is, if we terminate this and we're saying we don't have an emergency in Calaveras County, are we still partners in the test site? And what is our economic commitment to that?
So
go ahead, I'm sorry.
So Dr. Kaleda can affirm or correct me on this, but if the local health emergency was terminated, I don't believe that would have any impact on it doesn't necessarily need to have an impact on the decision to keep the testing site operational. Again, that's a state testing website. It's a state testing site. And Calaveras and Tuolumne's Public Health has been more in a technical assistance format for that particular testing site. The two, there isn't a fiscal ramification per se, other than kind of looping back to what John had just said about the removal of a local health emergency does have the potential to impact the ability to reimburse for anything health related upon including staff time.
Okay, thank you. Dr. Kaleda, did you have some comments to make on this?
Yeah, well, about the specificity of the testing site, repealing the local health declaration of emergency blows a hole in our ability to get reimbursed for our own local activities that are used to help prepare and operate that site. A couple of thoughts about the issue in general. I don't support terminating the local declaration of emergency at this time for three main category of reasons: federal, state, and local reasons. Federally, on March 13th, the president declared a COVID-19 pandemic of sufficient severity and magnitude to warrant an emergency declaration for all states, tribes, territories, and the District of Columbia, pursuant to something that's called the Stafford Act. John Osborne can tell you more about that, and that has implications for federal reimbursement, primarily through FEMA. For the state, the governor declared a state of emergency on Wednesday, March 4th, in response to California's coronavirus epidemic. The state emergency declaration allows for relaxing of regulations, provision and access to emergency funding for state and local response efforts, activation of emergency operations and response agencies to gain access to mutual aid supplies, staffing, and life-saving medications unable to be acquired locally. Other examples of the state of emergency allow for hospital bed capacity, purchasing of medical equipment to combat a potential surge of COVID-19 patients, protects hospitals, nursing homes, and other facilities most vulnerable to the spread of COVID-19, provides life-saving services to Californians isolated at home, supports local government to reduce the spread of COVID-19 in homeless populations, and provides safe beds for people experiencing homelessness, and provides funding for childcare facilities that remain open. And in my estimation, the most, of course, the local state of the federal state of emergency is still in effect. The state of emergency is still in effect. No county in California has repealed its local health emergency. And that's the most important part of this. Locally, aside from the funding and the reimbursement issues, a local declaration of a health emergency sends a message to the residents of Calaveras County that we take their health and safety seriously, and we're in charge of our own destiny. Most emergency responses in the United States aren't meant to be a top-down thing, but that rather they're a bottom-up thing. It's local authorities that are the first line of defense. They filter up to governors and state governments, who in turn filter up to the national government, which coordinates the largest efforts. So like I said, no counties in California have rescinded their local health emergencies. I've yet to hear a medical or public health argument for why terminating the declaration of local health emergency is a good idea in the middle of a pandemic.
Supervisor Stopper.
Thank you, Ms. Callaway. I have multiple things here. I appreciate Dr. Kaleda's position. I have some questions to start with County Council. When the doctor rescinded his order, did this affect the supervisor's resolution ratifying the emergency by the county health director? When reading through this, we need to ratify the public health director's emergency declaration within 7 days so that it continues. The state added in a provision that into their state provision that we didn't need to renew it every 30 days. But I see a certain hole here now that I've been like sitting down. This didn't really come to me now, is the doctor did rescind his order. And that's the way it was stated. He may have redrafted it, but he said he rescinded his order. So what does that do to our resolution that ratified that?
Okay, so I can attempt to clarify. What you stated is absolutely correct as to state law with respect to local health emergencies. They may be declared, they're to be declared by a local health officer, ratified by a county board of supervisors. And as you said, typically that's something that would need to be renewed by the board of supervisors at least every 30 days, but that requirement has been waived by the state for this particular emergency, such that it remains in place until such time as the board takes affirmative action to terminate. So that remains in place. And that is the declaration of a proclamation of a local health emergency. Then Dr. Kaleda had issued a specific order under the umbrella of this declared health emergency that was intended to mirror what the state's executive orders were and try to clarify and provide some additional direction for local residents and businesses as to what was permitted or not at that time. That has been, that specific order, and there were a couple actually, have been rescinded by Dr. Kaleda, such that we're operating within the default, for lack of a better word, of what the state's current orders are. So while those particular orders that the local health officer made were rescinded, the local health emergency declaration remains in effect.
Okay.
Does that clarify, hopefully?
Yeah, well, I kind of see a hole in that, but that's just my position. So to move on, I want to thank Dr. Kaleda for bringing up that none of the other counties that we know of at this time have terminated their local safety orders, even if these counties have chosen to open up more quickly than the state is allowing. So like Riverside still has their local order in place. They're bannering back and forth about this. We're aware of other counties receiving commentary from the state, let's say from OES, threatening their eligibility for disaster funding if they don't follow the state order. It's to the point, I don't know how else to describe or put it into context, but it's almost extortion to that point. But at the same time, at this time, we will still be underneath the state direction, and any businesses that chose to open up, if we were to terminate this health order, would still be subject to state penalties or losing their license if they're oversight by the state when it comes to their business license, correct?
That would be my understanding, yes.
And I do, Mr. Mills does have a very good point when it comes to the state law that was passed in 1970 when it came to the emergency declaration legislation. This was originally framed by Mr. Kohler, a supervisor of Placer County, a few weeks ago, and has been a ongoing debate in many counties because there are some issues. But at this time, we are opening up faster. The governor is moving things from phase 3 to phase 2. The only thing we're going to do if we were to terminate this would be to hurt ourselves in accessing funds in the future to possibly pay ourselves back for our reaction to this. I mean, it would be as much as, banning a business that paid $13 million in taxes and thumbing your nose at it, and then, not coming up on our emergency stuff from the Butte fire. We still haven't received everything from that. And this was a big debate on our budget last year. So we'd be impairing ourselves further and putting ourselves further in the hole if we were to effectively terminate this at this time.
Yeah,
I'm
based
looking
on
for
communications that we've seen from the state to other jurisdictions, that definitely seems to be that's the possibility.
Okay, yeah, and I just want to reconfirm that no other county has terminated their local health order that we know of at this time across the state.
So far as I'm aware, and Kristen, please correct me if I'm wrong, no county which put a local health emergency into place has since terminated it.
Exactly. We're using the terms interchangeably, and they're distinctly different. So health orders is one thing, and an emergency declaration is what no county has terminated. We in Calaveras County, for the most part, we have one specific clarification on short-term lodging health order that still remains intact. But with the recension of the health orders that were meant to do all of the things Sarah said, that were meant Dr. Clay put into place to clarify the state's order, and they mirrored those have been rescinded. The emergency declarations throughout all of the counties in California, to our knowledge, and we have checked, then have been rescinded, and that's particular to the declaration itself.
Okay, thank you.
Thank you. Supervisor Garamendi.
Thank you very much, Madam Chair, and thank you, Supervisor Mills, for bringing this forward. I always appreciate an opportunity to have a long-winded discussion. I know not all my board members like that, but since I did take down some notes, I would like to go over them. First off, I'm not a constitutional lawyer. I'm not a doctor. I'm going to leave that to you guys. We do policy, so that's what I'll speak about. But I want to start off by really, as I thought about this agenda item over the weekend, I want to start off by stating how proud I am of our county and our citizens, and particularly our county staff. 10 weeks ago, when this balloon went up, we all were scrambling to figure out how to put things together. And in that time, we've established systems between the cities and the county, between OES, between our fire, our hospitals. Everybody came together, and oftentimes working in a very stressful and sometimes dangerous environment. And I really want to thank our community for all that we've done to make this happen. We took our guidance from the state and the federal government, and I think we stepped up and did our part. Specifically, in the county, we had organizations like IT that makes this meeting happen. That's probably going to have an impact that's going to change the way we're going to do business in this county forever, maybe. They did that. Our custodial staff, OES, public health, our DA help have some of our workers come and help us, probation. Our school districts have stepped up and fed a lot of our residents, especially in my community. I'm very proud, and I'm really thankful to them all. I think as we were preparing for this, I wanted to remind everybody, 10 weeks ago, this board was told if we did everything we could, we might only lose 800 residents at Calaveras. And we sprung into action, and we got things done. And I think it's important to remember that because it brings the context to the decisions that we made along the way together. Our goal was to flatten the curve and increase our healthcare capacity, and we did that. And that's awesome. The goal was never to have nobody get sick. It was to prepare ourselves so when the wave hit, we didn't get washed out to sea. And in many ways, our county did a great job, and we won. So the question that Dennis wants to put forward is, do we lift the local state of emergency despite the state's declaration? And do we consider following other counties that have been considering that? I agree with Dennis and Ben that it is time to move ahead. I'm as frustrated by stay at home as everybody else, and I believe that one size doesn't fit all. But I also believe that Calaveras deserves pragmatic leadership, and this is nothing more than a political statement. While political statements well, this is a political statement that would cancel order. I guess I'd have to ask the question, does it serve a pragmatic goal for our county? We're almost at the end of this. I mean, the rules are changing every week. They're likely to lift even more today. So I think we have to be practical and that the rules are going to end. What we stand to lose is pretty obvious. We stand to lose, as John pointed out, all of our money that we put forward is theoretically at risk, that 579 plus additional expenses. We risk losing a partnership that we forged since the Butte fire with Cal OES. Let's recall we've got 7 open disasters in this county and millions of dollars on the line, and that money flows from the federal government through OES to this county. So we have a lot to lose, and the state has a big hammer over the top of us from schools, property taxes, disaster funds. And I recognize the frustration that people are feeling, but I think we have to be pragmatic about where we are. And we have to realize we're a small county, and we should never be poking someone in the eye, be it the federal government or the state government, when we've got our hand out. And that's exactly what we're doing. We're standing there with our hand out for a lot of disasters, for this one as well. We have no gain in poking the governor in the eye. We have no gain in poking the president in the eye. We're doing a good job. And I think if we just stay the course, we're going to come out of this, and we're going to, we'll evolve out of this, and we'll get reimbursed. So as policy leaders, we need to be pragmatic in our approach. And we don't need to participate in some of the sport that other counties are taking on for whatever their reasons. People of this county want pragmatic leaders, and I hope that's why they voted us in. So I'm not going to support canceling this. I think we hold the course. I think our staff is doing a hell of a job. Our community is doing a hell of a job, and we need to support them and help them emerge from this COVID and avoid political sport as best we can. That's all I have to say, Madam Chair.
Thank you, Supervisor. Supervisor Tuffanelli?
Yes, thank you, Supervisor Garamendi, for all of your comments, Supervisor Stopper and Supervisor Mills for bringing this forward. I can't support this at this time because I believe we are still under an emergency. We still have people staying home. We still have businesses not open. We still have restrictions by the state and the federal government as far as mass gatherings and everything. So we are still under a state of emergency until everything is back to normal. We are still under a state of emergency for the Butte fire, and the Butte fire has been long ago, 23 years ago. We're still under winter storm, as we have some objects coming on our agenda later on today concerning winter storm. We have not rescinded any of those because we are still recovering, and we are still recovering at this time from this pandemic. And until things are back to normal and we are not spending dollars and we don't have people staying home, not being able to go to work and earn a living or open their businesses, we are, whether we like it or not, we are under a state of emergency. And to rescind it at this time just does not make any sense whatsoever. So I cannot support it.
Thank you, Supervisor. Most of what Supervisor Tuffanelli and Supervisor Garamendi have said applies to me. I appreciate Supervisor Mills bringing this forward. It is a discussion we needed. I just feel that the risk that we have, not only financially, but to our community, I'm not ready to say as a county, we are going to be open, period. It's going to be business as usual, because I don't think we're ready for that. I do have Mr. Mills, did you want to say something? I have a letter to read, and I haven't asked for phone calls.
Yes, ma'am. There's a great appreciation here for the good conversation from each one of the supervisors and bringing their points up. I think it's long overdue. But at some point, the counties and the cities are going to need to decide when this is over. And please understand, I have no political skin in the game anymore here. So this isn't a need to make a political statement. It's just simply my feeling is that the case has not been proven that there's a need for a declaration of emergency. And that has been proven just through time and the facts that are there. And I hope that we would spend more time dealing with the facts rather than being concerned about the financial implications of this, because if it's about the money, that's really a sad way to fly. So that's all I have for now. Thank you.
Okay, thank you. Mr. Garamendi, did you have something else to add? No. Mr. Stopper, you had something else to add at this moment?
Yeah, couple things. You know, talking to some of my constituents, debating about this very issue. One brought up a very good question to me, and I think I had a good answer to this, because this is something I've been considering carefully when dealing with this. Is the order impairing our civil liberties? I would say yes, it does in a way, but not more so than the state. The doctor has rescinded anything that was more encumbersome, let's say, than the state has put forward. We are moving right with the state. Something I think needs to be included into this conversation right now is how do we plan on proceeding as a county? You know, because this health order affects how our employees are working. All our employees are considered essential. I'm getting calls from multiple constituents on different issues, being held up, not getting answers from phone calls into staff on applying for certain permits for certain things, and so on, to the point where they've been being put off for 20, 30 days before there's even a reply to something going in. So I think we need to also include in this discussion how we're going to move forward as the county right now, and how are we going to move forward safely beyond just our order within here, but this order affects how we conduct business. And that needs to be part of this conversation right now also.
Thank you. CA, did you want to address anything that Supervisor Stopper said? I know you have some plans in place.
I don't have anything valuable to add to the discussion at this point beyond what John and Dr. Coletta have provided to us.
Okay. I think what Supervisor Stopper was talking about are what are the plans in place for the county to maybe start unlocking their doors.
So in terms of that, I've been working with the department heads to start putting plans back in place to prioritize what our services will be that we will provide to the public. Our plan right now is to identify what those services are by department and what things will continue to be done electronically or telephonically. And we'll put that out to the public as we have that completed. But our anticipated date is the 15th of June.
Okay, so halfway through June, before you start getting the county employees back to a semblance of what we were working on before?
Yeah, for a variety of reasons. I apologize, I missed the question originally, Supervisor Stopper, but the Cal OSHA guidance for bringing any office employees back is not as broad as we might think. So what we're putting in place is a variety of things, from the protocols that will be followed, sanitary wipe in, wipe out procedures, exactly what we'll be providing for services and what we won't be providing, so that everything we do will be consistent with the Cal OSHA standards of the same as all the other office-based businesses in town as well. So that's what we're preparing at this point in time. Now, we won't be on the 15th, won't be broadly open to every service except for departments where we can ensure there is social distancing and lines, for example, in hallways, as an example, don't create issues for employees coming in and out of offices and, say, for example, going to the restrooms or taking breaks or whatnot. So we're just trying to make sure that we keep our employee as limit the exposure as much as possible to our employee, and same for the public as well.
I understand 100% where you're coming from. Personally, from where I'm sitting, my view is maybe it should be happening a little bit faster than that. And also, me as a board member, I'm in favor of starting having meetings in the chambers again. I'm watching multiple counties across the state and following what they're doing. And there are quite a few that have the supervisors at the dais spread out across there and staff spread out in front of the dais and stuff. And they're facilitating meetings in person, circumventing some of the potential technical difficulties that we've had in the last couple of meetings.
Supervisor Tuffanelli?
Yes, I want to say that I support Supervisor Stopper in those comments, and also want to make a point to this item. If the state and the federal government lifted all the restrictions today, or we voted today to lift all restrictions here in Calaveras County, I would still not vote to rescind this state of emergency, because we would still be recovering. You can't just turn the light switch on and off that quick. Again, going back to Butte Fire and winter storms. Even when it comes to that point, I think we still need to keep it going so we recover all of our costs. We don't know unforeseen costs that are going to cost the county and our constituents after everything is already opened up. So if we do have a conversation in the future about us going rogue ourselves and opening everything up, I still would not vote again to lift the state of emergency until we find out exactly what our costs are. But I would support Supervisor Stopper of getting back to our regular meetings in the boardroom.
Do I get to pick where y'all sit?
No, we get to vote where you sit.
Well, I think maybe that's a discussion that I'll have with the CAO as a sidebar on whether the board should be back in the boardroom, because I don't see how we can get 6 foot distance between each of us. But I will work on that, supervisors. I'd like to read a letter into the record. We had a one letter on this, and 4 phone calls waiting. Okay, I'll read this letter and then I'll take the phone calls. This letter is from Dr. Roger Orman. Please don't vote to go against the public health recommendations for social distancing and stay-at-home orders. We in Calaveras County have only had 13 cases of COVID-19 and no deaths due to the good work that our citizens have done in locking down and isolating us from the rest of the infected Californians. Our cases are low in Calaveras County because of how careful we have been. Don't ruin it now. Look at the rest of California with over 90,000 confirmed cases and 3,700 deaths. We have lots of visitors, and they will be the ones to bring COVID-19 to our residents. Opening up the county for business must be done slowly, as new cases will not be evident for 2 weeks. Our population is mostly over 60 and at high risk of hospitalization and death. 35% of those infected have had no symptoms but still spread the virus. Social distancing and wearing masks in public will protect us. Don't use the lure of a vacation and wine tasting in Calaveras to bring COVID-19 to us. Please continue to follow the rules set forth by our public health officials. Thank you, Dr. Orman. I have a call from 0233. You're on line with the Board of Supervisors. I'll come back to you. 1748.
Hi again, it's Sissy Hedrick.
Oh, hi, Sissy.
I know, long time no see. I'm just trying to figure out the difference. I understand not lifting the state of emergency order, but I'm not sure what it means by not lifting the health order. That's my first question. And the next question is, could we think a little bit out of the box and not think about what a mass gathering is when it comes to our kids? Can we think about if the churches can be open because they are essential, and I believe they are? This isn't a mass gathering if it's students with their parents. If we think out of the box, we can make things happen without breaking rules, and we can really separate those people out there. That's a very big field. Again, I'm saying, I think sometimes we need to think a little bit out of the box and not just be so stringent on one thing. It's not a concert. It's not a party. It's a celebration for people, and it is essential. Thank you, Marita. You guys have a great day.
You too. A call on 1491.
Hello?
Yes.
This is Al Segala of the Taxpayer Association. I want to thank the supervisors and you, Marita, for doing an excellent job. This is a hard topic to discuss. One of the things that is important is that we have factual information and that we all have the same purpose. If our purpose is to manage the crisis, we will have a different outcome than if our purpose is to end it. I'm in favor of ending the crisis. One way to end the crisis would be to actually kill the virus. I previously mentioned that there is available masks that have two-way protection. They have a chemical that kills the virus. I think it's called copper oxide. These are available on the internet. And what surprises me is that doctors are not looking at this. The doctors should be concerned about their patients. They should look at what's available to help their patients. The silence about the antivirus mask, to me, is appalling. The second thing is that we need to help and extend efforts to the people most subject to catching the hurtful effects of the virus, are older populations, which would include me. One of the things that is important is that our immune systems, particularly the older people who are vulnerable, should be at its best. This means nutrition, exercise, and our medical people who should be leading the way are turning their back on this. This is no time to turn your back on nutrition. I think that even if we didn't look for authority to tell us how to think, we would still be able to overcome much of this by the people who are responsible for the long-term care facilities looking into this themselves. And perhaps now is the time that they should do so. Thank you.
Thank you, Mr. Segala. Our meetings are never a true meeting without your comments. I'd like to go back to 0233. Is that Miss White?
Yes, let me unmute. Yeah, this is Vicki Ranke.
Oh, hi, Vicki.
Hi. Yeah, I'm just calling in to make my comments, and I want to thank Supervisor Mills for bringing this up for conversation. I don't know what the result will be, but what we all hope the result will be in the near future is that we open up our county. We know we don't have the virus here. We haven't had it here for a long time. People are doing what they're supposed to do, social distancing, wearing masks in the stores. We understand, and washing hands and keeping our hands clean. And the idea that we are going to continue doing this because the government tells us to is very upsetting to people like myself when we don't have it here and we continue to say, well, we have to do it because the governor tells us so. No, that's wrong. We elect you officials to represent us and to do what's right by the people. So many people have lost their incomes here. I know store downtown Angels Camp is closing because they can't continue to function. And then the idea that, well, we need money from the government for what? Because they shut us down and now we have to get money from them? No, this is not right. We need to take control of our own county. We know what it is. And yes, people might start coming up from the Bay Area. We'll be monitoring that. Nobody wants to overwhelm our hospitals, but it hasn't been. We haven't had one patient in a hospital. And when this virus first started in January, we were out there doing things because nobody kind of knew about it. We weren't social distancing and we were all fine. Then all of a sudden we had to all stay home. We all agreed to that for a while, but it's done. We're tired of it. And I agree with that gal that called in about the being able to have ceremonies for these graduates. We don't have it here. These are local people that would come to this graduation if you limit it to just the close family. I guess what we want in our leaders are common sense leaders, not leaders who just go along with what is being told to them by the governor. So anyway, I don't know what else to say. The people are tired of this. We need to open up, however it works, whatever works out, but we need to open up Calaveras County. Thank you.
Thank you, Ms. Meineke. 3041.
Can you hear?
Yes, I can. Please.
Okay. First of all, I'd like to say Dennis Mills put it in an excellent fashion. We do not have an emergency here. And I was disappointed to hear that one other fellow comment that we should keep the emergency in place so that we qualify for state funding, and so it's all about money. You are bankrupting us as individuals. You are throwing out the baby with the bathwater. This stay-at-home order, it has served its term and needs to be ended immediately. And anybody that I hear say, oh, well, we're open now, the restaurants are open. No, they are not open. If you read the Moose Lodge's discussion about the severe limitations about being allowed to open, they are not open because the limitations are ludicrous. And so we are not open. Another thing regarding people who are fearful about Bay Area folks coming here and bringing germs, COVID is a two-sided coin. The other side is herd immunity. And, sorry. The other thing, masks. Cloth masks are virtually zero effective and should not be required. And the reason that I know that is because we are a granite fabricator, and granite dust goes through cloth, and so does COVID. That's my comment.
Thank you.
We need to be fully open. This phase 2 opening is not open.
Thank you. Appreciate those comments. 4541.
I'm just here for whiskey, just checking back in. Thank you.
I'm sorry, I didn't understand that.
I'm just here for a later item on the agenda.
Oh, got it. Okay, thank you. All right. If there's no other public comments, I want to bring this item back to the board. Mr. Mills?
Yeah, we have to flip the screen so we can raise our hand. There we go. The idea of bringing us back into the boardroom would also help with complying with the ability of people to redress their government and political activity. So having them come before us and look us in the eye, I think is a critical piece of what we do and how we receive our constituents' information. So this has been a great conversation, but it's like when we knew we were going to be opening up restaurants and religious activities, etc., we should be preparing for those things now, not waiting for the governor's order to decide what we need to do next. And so I know the CAO and I've heard another supervisor mention the need for us to begin those preparations now and the value of that so that we don't get caught flat-footed and waste a lot of extra time getting it done. So I'm also sensing that there isn't sufficient support for this resolution, so there would be no need for anyone to make a motion.
Which means you.
Or anybody else.
Okay. I do want to say, and I've heard Mrs. Stranger address this, they are working on what's going to happen next, so they're not last minute. And I believe Supervisor Garamendi addressed that, and I have to echo it. I believe staff's been working, so we're not at the last minute scrambling to implement changes. This is an action item on the agenda. Does any supervisor wish to make a motion to terminate the declaration of a local health emergency?
Ms. Calloway, can I speak for a moment? Not necessarily to make that motion.
Yes.
I think Mr. Mills did bring it up once again. Getting back to the board chambers is important to me. I think Supervisor Toffanelli definitely had a good way of putting it. We'll be out front working with the people. I think we need to get back to that point. I think that Kathy Galino and her report today and what she's doing to work with businesses shows that the county has been doing some proactive work before things have opened up. She discussed different meetings with different businesses that are happening this week prior to it. Those businesses actually having the go-ahead from the state. So I do appreciate that. I think that when it comes to our service of the people, I'll reiterate the fact that it's important that we get as many employees safely in a healthy way back to work where they belong at the county in hopefully a faster timeline than mid-June. But that's just, where I'm coming from. And just the fact that from the way things were presented today and hearing all the facts, in no way does terminating this health order help the community open up as opposed to what the state is enforcing on people. And I cannot support terminating this health order at this time because of that reason.
So as I understand you, Mr. Stopper, you want to open up the government center before other offices are allowed to open.
That I didn't say it in that fashion, but it's not other offices, Rita. They are all considered essential workers. Our county employees are all essential workers.
That's not the question.
Well, that's the answer.
The question is, I have an office building. I'm not a government employee, but I have office space. So do you want the government center offices to be open before other offices have that same?
Again, I will repeat, those other offices are not essential. The government offices are. That's the same answer. So yes, it would be because they are essential.
Okay, just wanted to make sure that's what I heard. Is there any other comments before I move on? Okay, I want to move on to recognitions and acknowledgements. Mr. Stopper. Wait, hold on just a moment, please.
Madam Chair, I think Supervisor Mills had his hand up.
Supervisor Stopper, I forgot an item. I'm sorry. I'd like to move to the OES resolution to adopt a resolution affirming the local emergency proclamation made by the County Office of Emergency Services Director on March 10th. CAO, did you have something to say on this?
Not on this item. I thought that Supervisor Mills had his hand up, and I was just alerting you to that. I don't know if maybe I missed it or was in error.
You were in error.
Okay.
Sorry.
Sure.
Mr. Osborne.
Madam Chair, thank you. I think what Supervisor Mills was saying was item number 4 with his hand.
Sorry, Dennis.
Which is this, as with any other local emergency, when public assistance has been granted, we must continue that until we are fully recovered, which includes reimbursement for that. And so it has been, it's time to review the local emergency, which is ever so slightly different than the local health emergency. The local emergency that I declared gives us access to operate the EOC and access to state Office of Emergency Services funding and opportunities that is slightly different than the health order, the local health emergency. So the local emergency declaration does need to be reviewed periodically. And so that's what's before you today. Feels like we've had a robust conversation about this, so I'm happy to entertain any questions if anybody has any.
Mr. Mills?
So, John, you're stating that agenda item number 4, March 17th, ratifying the declaration of local health emergency is not what you're discussing here.
No, sir. This is the local emergency proclamation that I made as the director of OES, not Dr. Calaveras. The difference being Dr. Calaveras, Governor Newsom waived the periodical review process for Dr. Calaveras, but he did not for the local emergency proclamation that I made.
Thank you for the response.
You're welcome.
Are there any other board questions or comments on this item? Are there any public comments on this item? Can you please put the phone numbers up? Does 4541 have something they'd like to address to the board?
Nope, I'm still here for a later agenda item.
Okay, thank you. I am going to close any public comment and bring it back to the board for action. Supervisor Tuffanelli.
Yes, I do have some questions. It brings up the fact that we apparently have two states of emergencies here declared for the same thing in the county. And as I read what's on the agenda item, if we rescind this state of emergency, we also put ourselves at risk for any FEMA or state emergency relief funding. How did we get in the position where we have two covering the same thing? And is it possible to get rid of one and keep the other one and still stay in place? I just don't know how we ended up with two covering the same situation. Maybe, John, if you could explain a little bit more about that.
Yes, sir. Thank you for the question. The reason or the way that we round up with two is there is the Dr. Clada can declare a local health emergency, but that doesn't necessarily mean that there is a local county emergency. An illustrative example is if we say had a measles outbreak at a local school, that could be a local health emergency, but not a county-wide emergency. And so it seems like it's splitting hairs, but it's just different layers. This is a county-wide declared emergency, much like the Butte or the 17 storms that we've talked about in the other items. And what this does is it declares an overall emergency, and that makes available to us the public assistance funding from FEMA through OES, and if it were granted, CDAA, which is the California Disaster Assistance Act funding as well. So it's a vehicle to access the Cal OES funding and the FEMA funding.
So that brings into question another question then. When we apply for the funds and we send in our information, how are we separating the two so we don't overlap and ask for relief for the same thing on each one of them?
Double dip.
You got it.
And what we've been doing with that, Supervisor, is tracking our expenditures and both live, real time, and updating that with Cal OES. We've filed an initial damage assessment about every 2 weeks, 2 to 4 weeks, to keep them abreast of where our costs are. And we're physically tracking labor and equipment in a specific job line item.
But you have two states of emergencies. Do you not have to apply separately under each one of them for refunds or for funding under this emergency and then separately under this emergency? Or are they both blended in and you just apply for the funds? It seems to me with two that the funding would have to be kept separate. You'd supply information for each emergency.
To steal a quote from our county council, it depends. Some of the funding is...
She said that a lot.
Some of that funding has been directed and handled by public health, by Kristen, Director Stranger's shop, and the majority of the others have been handled by my shop. We did that very intentionally to try and keep that separate. And fortunately, we have our finance and administration section chief in the EOC who's in charge of tracking this mess is from public health. And we have been very intentionally sorting off what we thought was going to be reimbursed through a public health program and what was going to be reimbursed through, for a lack of terms, an OES program.
Okay. That's all the questions I had.
Thank you, sir.
Supervisor Mills?
Yes, John, thank you. I had asked the question in the previous agenda item about how much we've spent on the local health emergency. You said 579,000. How much have we spent on this particular proclamation?
So I don't differentiate between the two. What we have spent so far for the COVID-19 pandemic is that $579,000 amount. Now, if there is a direct program, and to be illustrative again, like the Great Plates program that everyone has heard a lot about, we have tracked that separately, same as Operation Room Key, which is it's actually a blended funding stream, some of it from FEMA, some of it from CDPH, and some of it from the state. So we've been maintaining as much as we can those funding streams separately for those tracking purposes.
So it's sounding to me like one of these declarations does one thing and the other declaration does another, but it's kind of almost like a duplication of effort here because you have two separate declarations that are blending the same funds.
Well, the declaration itself doesn't blend any funds. The declaration, my declaration, is what allows us to access the Cal OES and the FEMA funding. There is a single FEMA declaration, which is data report 4482 for COVID-19, and that will flow through from FEMA to Cal OES and down to us.
So if we had eliminated the local health emergency, you'd still have this emergency in place to collect a good majority of the money that would be due. Am I correct?
Well, I reached out to Cal OES and posed that exact question, and was told that if we discontinued or terminated our public health emergency, then obviously it would be hard to justify to FEMA or Cal OES a reason for the countywide emergency, and we would place the public assistance funding through FEMA at risk after the date of termination.
I've got to absorb that.
So. Sorry. So let me see if I can break that down a little bit further so we have a faster absorption rate. If we ended the public health emergency today, that's like saying that there's no that the county does not need any help from the state or the federal government. So anything from past the termination date or the discontinuing of the county emergency is effectually saying we don't need any more help from the state or the federal government. And of course, I would contend that we do because we haven't received any reimbursement from them yet.
Well, I draw a parallel to fire, and that is that when the fire is ongoing, there is, of course, a local emergency regarding the fire until the fire is put out. The Butte Fire of 2015 is, we're ongoing with our, what you've got there as a declaration for recovery, but the actual emergency is long gone.
That's true. But the local declaration of emergency is what you see come before you periodically. So this action item is exactly like the Butte fires, and it will continue to be renewed until we are completely recovered, which translates to until we get reimbursement from FEMA through Cal OES.
Okay, I'll scratch my head. Thanks.
As you can tell, I've done some of that too.
Guess we don't need to open the barber shops. Mr. Garamendi.
And we keep coming. I don't know why you guys are picking on all the bald guys. Jeez. Anyway, John, my comments are, I appreciate the fact that, we're keeping track of the numbers. The fact that you could tell me to the cent what we are expected to be reimbursed on Friday is a big movement. For the three of us that have spent the last 3 years, 3.5, almost 4 years, sorting through the Butte fire and then the rain events, as Gary pointed out, it takes a lot of time, and it's nice not to have to go back and try to forensically recreate all this. So thank you very much, John, and thank your team. With that, I'm willing to make a motion, Madam Chair.
You're on mute, ma'am.
All right, I'm going to make a motion. I can't hear this.
Thank you. I'm sorry.
There you are.
A motion by Mr. Garamendi, but Mr. Stopper wants to make a comment. Mr. Stopper?
I can hold off on my comment.
Oh, go ahead, because I have a motion on the floor and I'll be looking for a second. So it's open for discussion. No? Okay. I have a motion by Supervisor Garamendi. Is there a second?
I would like to hear what the motion is exactly.
The motion is as it's written on the agenda.
That's correct.
I'll second it.
Thank you, Supervisor. Mr. Stopper, did you want to make any comments?
No, Gary beat me to it, so.
You're procrastinating, Ben, so I stepped in.
All right, thanks.
Thank you, Supervisor. Okay, before I call for the vote, I'm going to open it up to any public comment.
Mm-hmm.
I have no public call-in on this item, which is to reaffirm the local emergency proclamation. I have a motion. I have a second. All in favor?
Aye.
Could you raise your hands, gentlemen? 1 hand, 2 hand, 3 hand. Dennis, where are you?
I'll be a no vote on.
Okay, fine, thank you. That will be a 4 to 1 with Supervisor Mills in the negative. Okay, thank you.
Thank you.
I'd like to thank you, Mr. Osborne. I'd like to move to recognition and acknowledgement, something very positive. Mr. Stopper, could you please take the lead on this?
Absolutely, Madam Chair. Let me get this to the right spot here. My iPad's not cooperating. Give me a second. There it goes. Okay, this is a proclamation recognizing community action and the Calaveras Mariposa Community Action Agency. Whereas community action is a robust state and local program connecting people to services and creating pathways to prosperity by promoting economic stability as an essential aspect of enabling and enhancing stronger communities and stable households. And whereas community action has made essential contributions to individuals and families, both nationwide and locally, by creating economic opportunities and strengthening communities through community-wide solutions. And whereas community action delivers innovative services and supports that create greater opportunities for families and children to succeed. And whereas the Calaveras Mariposa Community Action Agency, our local multi-county community action organization, is celebrating 29 years of providing valued services to local residents in need, innovation, impact, and proven results for our local communities. And whereas the dedication and commitment of CMCAA board, staff, and volunteers to the services of others through meaningful, community-driven work has greatly positively impacted the lives of those in need in our local communities. And whereas in 2019, CMCAA served 2,923 households and a total of 7,324 individuals through various safety net programs and community services for low-income and vulnerable populations, helping residents stabilize their household financial needs in an effort to attain self-sufficiency. With that, Madam Chair, I would like to see if anybody's on to speak for the Community Action Agency.
Good morning. Madam Chair, members of the board, Kristen Stranger, Health and Human Services Agency. Thank you, Supervisor Stopper, for that introduction and the reading of the proclamation. I just wanted to provide a few more staff comments on this item. The Calaveras Mariposa Community Action Agency was formed on May 28, 1991, under a Joint Powers Authority agreement with Mariposa County. CMCAA acts as the official community action agency for Calaveras and Mariposa counties. CMCAA is administratively housed within the Calaveras County Health and Human Services Agency. The mission of this organization includes helping local residents in Calaveras and Mariposa counties towards achieving self-sufficiency, becoming involved and contributing members of our community, promoting family and other supportive environments so that children, youth, and elders can achieve their maximum potential, and mentoring children, families, and individuals towards achievement of their maximum potential. CMCAA is dedicated to enriching the lives of low-income and vulnerable individuals through a meaningful service. The board and staff will continue to support and create new programs that align with their strategic plan, community needs assessment, and organizational mission. CMCAA is focused on building internal capacity in order to provide direct services to rural communities and local nonprofit entities. CMCAA recognizes the importance and value of many organizations that work to serve those in need and will foster opportunities to build and grow capacities to support this mission. Currently, CMCAA is supporting housing programs and outreach, housing-focused case management, and housing navigation activities in both Calaveras and Mariposa counties. CMCAA is also actively involved in short-term and long-term COVID-19 disaster response, recovery, and resiliency efforts. And with that's the conclusion of the staff comments.
Okay. Are there any public comments on this? Or any staff that want to make a comment on this? Okay. 4541, is this the one you'd like to make a comment on?
No, I will be commenting on the whiskey whiskey slide. Thank you.
Okay, thank you. Yeah. Public comments. Yeah. Mr. Stopper, would you like to proceed, please?
Thank you, Madam Chair. Therefore, be it proclaimed that the Board of Supervisors, County of Calaveras County recognizes community action in the Calaveras Mariposa Community Action Agency and their partners in their efforts to support and strengthen Calaveras County communities.
Could you call?
I'm going to make a motion with that.
Okay.
But I also want to say during, this type of time, when we're living through COVID and everything else, this is exactly the type of reason that we have things like CMCAA to support people that are in need of services that they aren't able to provide for themselves at this very time. With that, Madam Chair, I would like to move this proclamation.
Supervisor Mills.
Yes, as the other member of the CMCAA board, I would like to second it.
I have a motion by Supervisor Stopper, second by Supervisor Mills. All in favor?
Aye.
Aye.
Raise your hands so I can count. Callaway, Mills, Garamendi, Stopper, Toffanelli, where are you?
On the other screen.
The
Okay.
other screen.
Yes, Marita.
Can I raise your hand for me, please? Thank you. This passes on a 5-0 vote of the board. Thank you, Mr. Stopper.
I will repeat my reading of the end of the proclamation. It moved on me, sorry. Therefore, be it proclaimed that the Board of Supervisors, County of Calaveras, recognizes community action and the Calaveras Mariposa Community Action Agency and their partners in their efforts to support and strengthen Calaveras County communities. Passed and adopted by the Board of Supervisors of Calaveras County, State of California, this 26th day of May 2020.
Thank you, Supervisor Stopper. Okay, I'm going to move to general public comments. If there's any item of interest that's in with the subject matter jurisdiction of the board and is not posted on our current consent agenda or regular agenda may be addressed at this time. I'd like to go back to the woman on 4541. As I understand, this is the one you've been waiting for.
For the Whiskey Slide project?
Oh, I am so sorry. I totally misunderstood you. No. In fact, the Whiskey Slide project will probably be hearing this afternoon. Is there a way we could call you and let you know, and then you could call in again?
Sure, if I'm needed. I'm just, I'm not really providing comments, but I was the environmental consultant, so I was just going to make myself available if there were environmental related questions to the project.
Got it. So does staff have your phone number? Oh.
I can provide it to Jennifer Ellis if she does not have it.
Okay, if you could, thank you. I appreciate it. Sorry to have kept you waiting. Okay, I want to go back to general public comments. Mr. Segala, if you're out there, I'd love to hear from you, even if it's a hello. Okay, I'm going to wait a moment. See. Okay. Okay. I want to there's no public comments at this time. This is sort of one of those reasons why it's nice to have an open board meeting where people can come in, but we'll get to that later. The pleasure of the board, we can take a break now or do the consent agenda and then come back to take a break and then come back to the regular agenda. Does any of the board members have a problem with just continuing to do the consent and then take a break?
Madam Chair, I think if we just did the consent, and because there's a lot of people waiting, we could just let them go have the rest of their day while we go forward.
Oh,
so
okay, former
I
chair.
agree with you.
Okay. Okay, let's move to the consent agenda. These items are normally routine, non-controversial, and will be acted on with one vote of the board unless any member of the board, staff, or public wishes to pull an item. Supervisor Mills.
I'd like to pull item number 18.
Supervisor Toffenelli.
I'd like to pull items 19, 20, and 21.
Okay, thank you. Any staff member wish to pull an item off of consent? Is there any member of the public who wishes to pull a consent agenda item? Okay, I'm going to bring it back to the board. May I have a motion on the balance of the consent agenda with items 18, 19, 20, and 21 removed from consent?
So moved, Madam Chair.
Motion by Supervisor Stopper, second
Mills.
by Supervisor Mills. All in favor?
Aye.
Aye.
Opposed? Passes on a 5-0 vote of the board. Excuse me, Supervisor Mills, item 18.
Item 18 is the Calaveras CAL FIRE contract for dispatch services. I know that in the past there has been some review from the county level as to whether this is really a valuable contract or what is the value to the contract. As you can see from what is being set there by previous agreement, we will continue to go up over $100,000 over a 5-year period. I would like at some point for us to review with CAL FIRE this contract and have an opportunity to see whether or not this is really the best choice or what other choices and options we might have. I know I've had discussions with the sheriff over it, and I know previous boards have had discussions over it. So it might be an opportunity at some point in the near future before we get too far along to have that conversation.
You're right. We have had discussions over this in the past several times. If the sheriff or the sheriff's representative is on the line, did they want to address this issue?
I see Rick is here.
He's got his hand up. He's in attendees, though.
Yeah, I believe he'll have to either call in or be switched to a panelist.
We can hear you fine now.
18, 19, 20.
Hey, this is Rick. What was it that you were asking about?
Supervisor Mills wants to know if this contract is in the best interest of the county, or should we review it at some point to see if that's a service your department, your dispatchers would like to take over.
And I was doing something else and I just heard the sheriff and that's why I chimed in. Which one, what item was that, Dennis?
18, the contract with CAL FIRE for emergency response.
Sheriff, I know you and I have had conversations about the dispatch service, and there has been, and Marita had just brought up the point, is this has been discussed before, but I think a periodic review from our side is in the best interest of our taxpayers to determine whether or not this is the best way to do this or what other options might be available.
I think at this point, and we have talked about this extensively, and I think at this point, I think it's better to leave it with CAL FIRE because not only are we dispatching, is the county paying for dispatch services for CAL FIRE, but they're paying for the services for our 9 fire departments. and we take the 911 calls and then we transfer it to CAL FIRE. I think it's best that it stay where it's at, being with CAL FIRE.
My point was, Sheriff, and I don't know if you heard it, but the contract will increase over $400 or $120,000 over the 5-year period. It's literally a quarter again higher than it was previously. So I just wanted to be sure that we're going to be able to absorb that, and whether or not that's the right direction to go.
Well, in talking with CAL FIRE, I've got Under Sheriff Macedo in here with me. There's a lot of infrastructure that would need to be put into place to get us up and running to be able to dispatch. I still believe that it's going to be cost effective for the county to continue with CAL FIRE at this time. We're not set up for it. There's a lot of other, I'll say, hidden items in the contract that we don't have the capabilities of doing at this point in time. You're talking about hiring more dispatchers, and I think that $120,000 that you're going to see an increase is going to be not cost effective because of the extra dispatchers that we end up having to hire. I still think you're better off to leave it where it's at.
I appreciate the conversation.
You bet.
Madam Chair.
A member from CAL FIRE who would like to address this?
Yeah. Madam Chair, Deputy Chief Mike Blankenheim is here as well in the meeting. He has assisted in putting the contract together. I do want to touch on one point in the contract. It shows the full maximum value of the contract, but one of the things that our local fire districts asked to be in the contract is some, for lack of a better term, some hourly services and some changes in programming in the way CAL FIRE will dispatch our local fire departments. Those are in the contract, but they would only be billed if needed. I'm pulling up the items. I think it was up to $30,000 charge in the first year based on changes that we request, and only if CAL FIRE needs to do programming changes to make the local requests to their system. So not the full value of the contract would necessarily be exercised unless our local fire districts have some changes that cause the added hourly charges. And again, Deputy Chief Mike Blankenheim is here as well, so it may be nice to give him an opportunity to speak to the item.
Please.
Before he speaks to the item,
yeah,
Madam
Mr.
Chair.
Mills?
Before he speaks to the item, I can go back to the time when CAL FIRE was doing the cards. And so it's a considerably different situation now. And I appreciate CAL FIRE's willingness to hang in there with us. But at the same time, I just want to be sure that we have the conversation and we know what it is, what we're getting for it. And I'm glad that the fire districts have weighed in and given their say on what they felt was important in this contract.
Thank you. Before we talk to the chief, Mr. Stopper.
Back to the point that Mr. DeBasilio brought up, our good sheriff. He talked about additional staff. I think quite a few of us have had this conversation with him over the years. There's also the initial investment into technical hardware that would need to be put into the dispatch center to actually facilitate being able to provide this service. And it's in the excess of, the final amount that was brought up on costs just in that. So long term, being pragmatic and thinking forward, the cost is exponentially more to transfer it to the sheriff's office at this time.
Mr. Tuffanelli.
Yeah, the other equation to this is we're sending an RFP out. We just had a presentation to us earlier today concerning ambulance service. And this affects ambulance service too. There was a quote a few years ago from the Sheriff's Department, and their quote for this service was considerably more than what CAL FIRE was charging every time that they sent an ambulance out. And that affected the costs of the RFP. The RFP as it went out today, or is going out later out this week, is through CAL FIRE. and those charges that they quoted in it. So it's just not fire department, it's ambulance service also that's affected. Just want to bring that up.
Supervisor Toffenelli, this is Sheriff DiBasilio. The RFP for the ambulance service does not affect the fire services. The only fire service that actually has ambulance service right now is Eva's Pass Fire. We do now dispatch all ambulance services within the county, not CAL FIRE.
So when a call comes in 911, it doesn't go circulate back over to CAL FIRE for their dispatch, especially in areas that you can't cover.
Not for ambulance services. They typically typically respond as fire, but not for ambulance services because CAL FIRE has no ambulance services available to them. It's all done through our local fire departments.
Okay, thank you.
Okay. CAO, is the chief available?
I believe that he's a participant in the room as we speak. Yes, he's in. Mike Blankenheim, Deputy Chief.
Yeah, good afternoon, everybody. Can you guys hear me okay?
Yes, we can. Thank you.
Yeah, well, like you said, Mike Blankenheim, Deputy Chief for the Tuolumne Calaveras unit. So yeah, I can definitely take any questions you guys may have over this, but just a couple quick comments before that. So a comment a few minutes ago, somebody talked about this paying for the CAL FIRE dispatching services and the local government dispatching services. I just want to make sure we're all understanding here that the contract with Calaveras County is to pay for the dispatching services for the local government agency. CAL FIRE self-funds its own dispatching services. So this is not paying for CAL FIRE to dispatch CAL FIRE resources. This is paying CAL FIRE to dispatch the local government fire agency. Just make sure everybody's understanding of that.
Thank you, Chief. Mr. Mills, did you have a question for the chief?
Sorry about that. Yes, I do. Chief, I know that, for instance, with these individual fire districts, there is going to be some, from time to time, modification of their dispatching system. And is that cost going to be part of this contract, or is that going to be a shared cost with that specific district?
Yeah, that cost will be part of this contract. It's written into the new fiscal legislation.
So if I might touch on that for Supervisor Mills as well, the local fire districts have, for lack of a better term, formed their own committee on dispatch services. I worked with the local districts committee in framing out the contract and their needs in this contract. So they do endorse what's in the contract. They're working hard within the local districts to be as uniform as possible in what they're asking CAL FIRE to do. So essentially, we've agreed that the dispatch protocol will be the same across all the local fire districts, so that CAL FIRE can dispatch in a way that all the departments know exactly how it's going to happen, and that is identified in the contract. But where the local fire districts want some programming modifications, that's where we've built in, if there's necessary, say, changes to the computer-aided dispatch system or whatnot that need to be done to facilitate what our local districts need. That there is a charge in the contract. But before we move forward in that, they'll work with me on what the changes are. We'll approve what the expenditures would be relative to the change, and then work with CAL FIRE together on having those changes be implemented. So it's been in this approach to the contract, it's been pretty cohesive between all of the agencies, the local fire, CAL FIRE, and the CAO's office.
I thank you for your response. The point is that several of the chiefs in my district have reached out, and they have specific needs or specific challenges. And just so those are part of the conversation, and that the chiefs.
Dennis, we're not hearing you. We can't hear you.
I think I can, it might be worth muting yourself and then unmuting again. Supervisor Mills, you cut out halfway through, but I will address the part that I heard was that the chiefs in your district, one in particular, is on the committee. And so we're working very, very closely with the quote unquote dispatch committee to make sure that their needs are incorporated not only into this contract, but as we move forward. So we are aware of their interest, their changes they're interested in, and it was part of the discussion in this particular contract negotiations.
I just wanted to be sure that that was brought up in the conversation.
Yes, sir.
And that they do have some responsibility to their constituents that they serve, and that has to have some value in this conversation regarding how dispatching occurs within their district.
Okay.
Okay, thank you.
Based on that, Supervisor Mills, did you want to make a motion?
I'll make a motion to approve the contract, but we will need public comment.
Okay. Oh, that's right. Thank you. Is there any public comment on this item? Seeing no public comment, I bring it back to the board. Is there a second on this item?
I'll second.
Second by Supervisor Tuffanelli. All in favor?
Aye.
Aye.
Opposed? Passes on a 5-0 vote of the board. Thank you.
And be sure to thank, Chair, be sure to thank Chief Blankenheim for being available and to answer the questions.
Oh, you want me to thank him too? It's
Sure.
not in the contract, Dennis. Thank you, Chief. Mr. Tuffanelli, items 19, 20, 21, do you want to take them collectively or individually?
We can take them collectively. I would like to move these items to the next meeting. I need time. This agenda came out Friday afternoon late. We had a holiday weekend. Staff wasn't available. I need to meet with Bonnie and have some extensive questions about it. These are 3 separate contracts with a total of $2 million each, which is $6 million. It could be out of general fund that would not be coming before the board of supervisors as the money is being spent. Anything above $50,000 or $60,000 normally comes to the board. It has a minimum spend of $50,000, but it has a maximum on each one of $2 million. And I need time to go over and ask specific questions on these items and sit down with Bonnie and go over them. So I would respectfully request that we move these items to the next board meeting.
Okay, does any of the board members have a problem moving these 3 items to our next agenda? Mr. Aul, is there a problem from your perspective to move these 3 items to our next agenda?
The potential impact is only to one project that's been a priority of the board, and that's the museum roof. It is one that would fall potentially under job order contracting. So it could potentially cause some bit of delay with that project. But I don't anticipate it'd be such a limiting factor that we couldn't put it out.
Okay, thank you.
I had a conversation with Bonnie about that specific item, and she said it would affect it.
Okay.
So.
All right, so not hearing any concerns from my colleagues, items 19, 20, and 21 will be moved to the next agenda item. Wait, she's just got it.
I think, Madam Chair, I think there should be a motion.
All right, I'll second Gary's motion.
Oh, dang. What good is there to be a chair if I just can't take action? Gonna move this puppy along. Okay, may I have a vote, please? Supervisor Tuffanelli, I know you've made the motion.
Yes.
Supervisor Stopper, is that a second from you? All in favor, say aye.
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 Opposed? Passes on a 5-0 vote of the board. Thank you.
Thank you. Thank you, board.
We're going to stand in recess till 1:15. 1:15. Thank you. Thank you, staff.
Rita, is my audio working?
Yes.
Excellent.
Are all my colleagues here? Yes. Got it. Susan? Yes. Ready? Ben's here. He got a haircut. He got a haircut. He went in the back door. I can see that.
Easy there.
You did. Who cut your hair, Ben?
I'm getting really good at it, Marita.
Oh, you have?
Yeah.
Oh, I read a YouTube thing on how to cut your own hair. I thought, I don't think so. I'll just wait.
Rita, don't you remember the Flobies?
The
thing you hook
Flobies.
to a vacuum cleaner and
Okay, ready to move? Okay. I'd like to reconvene the meeting, please. And we're going to go to regular agenda item 2. The first item is the library to approve an MOU with the Amador Unified School District to provide grab-and-go lunches for Calaveras County Library, curbside delivery for the county's children, school children, June 15 through July 31. I believe our librarian has spoken about this before. Are you, Nancy? Oh, you're with us. Thank you.
I am here. Thank you very much. Yeah, I'm really excited to see you all today, and I greet you, the County Librarian Nancy Giddens. I've watched with great interest your proceedings today. It's all been very, very interesting. I thank you for your great work. I'm happy to present this MOU to you, and I ask you today to please approve this. This is for the Lunch at the Library program that we received a presentation on in December from a couple of people from the State Library and CLA who have worked with this program for a number of years. Of course, the program has changed fairly significantly because of the pandemic, as libraries are not open. So the State Library, in its usual accommodation and flexibility, is allowing us to deliver grab-and-go lunches, and this is what Amador has agreed to provide for us. The State Library will provide the transportation costs for these and all the refrigeration costs that we will need, items that we will need to purchase to make this program possible, to keep the food safe for our children. And in addition to that, as you remember from the presentation, the need for this arose through our summer reading program, which goes on in our libraries every summer, so that we help children and their families to bridge the learning gap, which often takes place during the school year when children are out of school. And of course, that gap is going to be even more significant this year because children have been out of school for a number of weeks already. So we are happy that the State Library is allowing us to prepare not only grab-and-go meals for the children, but also takeaway learning packets with some grant money and with some help from the Friends of the Library. We have purchased a book for each child each week. We will have takeaway packets at 4 levels, the 0 to 5, and those materials are being purchased for us through our First 5 Calaveras grant, and then grades 1, 2, grades 3, 4, grades 5, 6, and each packet will have a book and activities for them. We're trying to make some activities. Some of them are crafts for the little ones primarily, but other ones we're trying to get the children outside to do insect hunts and things like that that go along with our themes. So the state library has agreed to continue to fund the Lunch at the Library programs that we will be putting on this summer, even though it won't be in-person contact with the children. And we're sorry about that, but we're happy that we can do this. So the starting point of all of this is your approval of this MOU, which will allow us to collect lunches each day, grab and go lunches, put them in ice chests for safe travel, and bring them back here to Calaveras County, where we will distribute them to children in need. So we're very, very happy that this year, the need is always great, as we learned in December, but this year, of course, we believe the need will be even greater, and any help that we can give through our library, we're just thrilled to be able to do that. So if you have any questions about any of this, please feel free.
Supervisors, do you have any questions or comments on this? Nancy, Ms. Gibbons, sorry, I do. This is only for really children that are in the west end of the county. What about the children on the east end?
That is a problem. Yeah, that's a problem that we have. And it the problem existed because of my difficulty in finding a provider for our food. So since the provider became Amador, I felt like in order to do this well and to succeed in our first year, we would just try it here. I'm hoping that in subsequent years, we'll be able to branch to the other school districts and to our other sites as well. So I am well aware that we're not doing as much as I would have hoped we can do. But at this point, no other school district here felt that they had the ability this summer to provide the food, which is important in the whole.
But if you could provide the food through Amador, and then it could go from your library to
yes, it could deliver
school.
You're exactly right. That could happen. However, Amador Unified provides for Amador's children in the summertime, and they've been doing this for 3 or 4 years, preparing many grab-and-go lunches for children in the summer. And their capacity to help us with this was not adequate for me to do more than what I'm doing, unfortunately. Now, what I'm hoping, what I'm hoping is that if we can succeed with this, that we can inspire these other agencies to help us with it, because we do have to have a safe and approved health food provider for the program to move forward.
Well, I find that interesting, since the schools, or at least the ones that service my district, were doing lunches every Tuesday or whatever for the students. And what makes that different than what this is?
When we were investigating this and setting it up, it was before the school closures. And so at that time, school districts were saying that they did not have the capacity to provide this. And that doesn't mean they don't have the money to provide it, because it is a seamless school lunch program through the USDA and CDE. But I felt like it was more of a staffing issue. Now, they have been required to do this during the school closures, so they have a lot more experience with it. So CUSD is still not able to help me increase this. However, I am hoping that perhaps we can help CUSD expand what they plan to do this summer, which I just found out about on Friday. So, I really think that the only way I can really explain this to you, is that this has been such an evolving and such an odd year for this program, that school districts have been called upon to do what they thought they couldn't do, and they have done it. So my hope is in the future, we will be able, through our library system and branches provide food for more of our children. But I think this is a test year, and I had to actually have all of this sort of in place for the MOU before the school districts actually knew what they were going to be doing.
Got it. Thank you. Thank you. Mr. Mills.
Yes, thank you, Chair. I have a series of questions here. You're currently serving how many in the summer program now, Ms. Giddens?
We serve about 300 children throughout our library system. And we will be, excuse me.
Go ahead.
We will be preparing takeaway packets for all of our branches, not just for here where we're doing the summer lunch. So each branch will have these packets for their children.
Thank you. Yes. And I noticed on packet page 747, preparing it each morning at 10:30 a.m. Is this daily Monday through Friday, or is this every day of the week, including the weekends?
Monday through Friday.
Monday through Friday. And what age range are we serving? Are we going to serve? It didn't mention it in the list.
We are thinking, well, it will be children who can eat food. So we will advertise it as basically 3 through 18. But teens can come for this food as well. And these, you recall from our presentation, that it doesn't have to be children who are currently enrolled in the food program. It's any child. So we're thinking we may serve homeschool children as well.
Or even like Mountain Oaks?
Yes. Yes, I mean, if those people came, we will distribute for as long as we have supply. Absolutely.
And what is the number that you think might be served by this particular program?
This is the very complicated thing. Yeah, it's a very complicated thing because normally in a school lunch in a program like this, what we would have required, and the USDA required it, is for the meal to be consumed on site. And that necessarily limits the number of participants because they have to get here. With this one, I'm telling you, I actually have no idea, because if parents have been accustomed to going to collect their children's food, and that's the other difference, is parents can actually collect the food, rather the child doesn't have to be there in person at all. So honestly, we're just going to do our best and provide for as long as we can. We don't really know what it will be.
So day to day, your numbers could fluctuate quite dramatically.
They could. I think they could. Yes, they could.
And what is the capacity of the Amador system? What is their maximum they say they can handle?
Well, before this, we were saying 80 lunches, which should have been enough for San Andreas. And I was hoping also to serve West Point, because West Point is a needy area that has a lot of children on school lunch. So they are preparing hundreds of lunches for their children. So whether they can provide more for me if we determine or we see that our need is greater, I cannot say at this time, but that's what they've agreed to.
Okay. Thank you for your responses.
You're welcome.
Mr. Stopper?
I'll let Mr. Garamendi go. He's been up for a while, unless.
Mr. Stopper, go ahead. You're talking.
Yes, Marita. Miss or Nancy, thank you very much. I just want to redefine what you said, and I want to make sure that we're on the same page, because this says that what we're signing here is good through July 31st of 2020. So, and pretty much when you were setting everything up, you were doing this pre-COVID. And with
somewhat, but yeah.
Right, and I understand that. And they're giving you a lot of leniency as you move forward, so we can revisit this possibly in the near future if places like CUSD or Bret Harte or Mark Twain have consistently been providing lunches that they didn't feel that they were able to in the past. Right. There's been some lifting on some of the constrictions, so there's a possible formula in our future for putting together a contract with this local school district, so we're not necessarily always going to be dependent on the Amador equation. Not that we don't appreciate them being good neighbors and working with us.
Absolutely. But that is my hope, yes, that if we can prove this is a workable solution, that it helps children not only in terms of their nutrition, but also their learning. I'm hoping that I can get the support of the school districts to do it on a broader basis.
Well, you have my support, Nancy. I appreciate all the work you've done.
Appreciate that very much.
Mr. Garamendi.
Thank you very much, Madam Chair. And Nancy, I mean, the whole board said this last time. I'll speak for myself. I'm so appreciative of what you're doing. It breaks my heart sometimes to think about in a country as wealthy as ours to have hungry kids. And the library is an evolving organization, and the fact that you guys are stepping in to fill gaps in our food chain in our community is really wonderful. I cannot thank you enough for doing this. And I agree with Ben. This is our pilot. This is our first one. It was sort of bridging that pre-COVID and current COVID crisis. I would love to find a way to keep that money local and help out our local school districts, because those are jobs for people. And I know that we weren't there, but as Ben pointed out, maybe in the future we can get there. And I would love to see this expanded as far as we can. And this is a wonderful program. Thank you. And it should be a priority for all of us.
Thank you.
Thank you, Mr. Garamendi. Are there any other comments or questions from the board? I'd like to open it up to public comment at this time. I didn't have to be reminded. Okay, hearing no public comment, I'd like to have a motion on this item, please. And don't everybody speak at once.
I will move this item, Madam Chair.
Thank you, Supervisor. And a second?
Second.
Second by Supervisor Stopper. The motion was made by Supervisor Tuffanelli. All in favor?
Aye.
No. Passes on a 5-0 vote of the board. Thank you.
Thank you very much. I'm just thrilled. Thank you.
Thank you, Nancy. Thank you for your work on this. We appreciate it, truly do. I'd like to move to item 25, which is an update from Public Works on disaster recovery activity throughout Calaveras County, not including 2020.
Good afternoon, Chair, Callaway, members of the board. My name is Joshua Pack. I'm your Director of Public Works and Transportation, and I'm here today to discuss the disaster recovery projects being worked on and administered by Public Works. Before I move forward, I want to verify that the board can see the PowerPoint presentation, that I'm sharing that correctly on your screens.
Yes.
Okay.
Okay.
Great. Technology working today. So really quick, a lot of this information you've seen before, I provide updates on. This is an opportunity for updates on all of the disaster recovery projects being worked on by Public Works and Public Works staff, primarily relating to the 2017 and 2019 winter storms. I'll also provide an update for a little bit on Butte Fire, and then the first time I'll be using this process to provide an update on the PG&E settlement funding that was adopted by the board around this time last year. So the first item is the Butte Fire. This is an update I provided to you in January, the phase 1 work. And this is there's a couple of different elements to the Butte Fire work from 2015. PW 88 is the roads element. And so phase 1 is complete, but phase 2 has seen a lot of delays relating to the other elements that are still waiting for approval. Public Works had attempted to close it close it out due to the delays. Calaveras had reached out to us and proposed an option where we could purchase the equipment necessary to do the repairs for the amount previously approved, and then move forward with those repairs using local funds. And for us, that's a great deal, especially with our needs on the equipment side. And so we submitted a request for that after the January board meeting, and we're still waiting on comments and feedback from FEMA on that. As you can see on the left side, and I didn't talk about this before, the blue box has the title, the budget, and then also the local matching numbers. A lot of these haven't changed, but I'm happy to go into more details. I highlighted on this one because there's some equipment replacement. We've utilized some public works budget that's already been set aside for equipment replacement as part of this. So if we are granted, we're going to use about $260,000 in the operating budget to help fund the equipment replacement that will then do the work as part of phase 2 using local dollars.
Mr. Pack?
Yes.
Can you go back to that slide, please?
Sure.
I wasn't clear when it said the local match for what? And then the 259,000 comes out of your existing equipment budget?
Yeah, and so
how
this
does
one's
that tail with the equipment that we're buying? I wasn't clear on that.
Yeah, and this one's a little bit of an odd duck because the rest of them are pretty straightforward. So under most circumstances, you're going to see the amount that is budgeted, and the older the project or the further along we are, the more we know what the actual budget is. And then when you see the local or the match, the local, that $20,000 you see in general fund, that was part of phase 1. And that's part of the breakdown between the federal, the state, and the local contributions for disaster recovery. Usually it's like 6.5% that the local matches, and the rest is covered between federal and state. In this case, it's a similar match, but we already had a budget for equipment replacement, and we decided to utilize that because we already had the budget set aside in the operating budget. It made sense, since we were going for equipment, to use that set aside. Now, FEMA has a little higher set aside for this category, so it's not 6%, it's higher than that. But our impression was, if we can get $1.6 million worth of equipment and spend $260,000, that's a really good investment for us, especially for our needs. So that's what that category is. And again, this one's a little bit of a odd duck. The rest, hopefully, are far more clear.
Thank you.
So the next project is the Butte Fire PG&E, and this is a project, if you recall, last year you approved about $13.5 million or so for Public Works to move forward. We've done a lot of work in the last year. On the equipment side, we had some equipment that was purchased. That equipment's been purchased. It's been utilized in these the road prep and preparation work. We've gotten a lot of work done. Most of the prep work for the construction is going to start this year is already completed. So that includes Jesus Maria Road, that includes Mountain Ranch, Railroad Flat. There's some other roads in that as well. So the work's broken in phases, and the board had initial feedback and comments on those phases. And then we did a series of public meetings with Supervisor Garamendi, and we made some small, modest tweaks to that based on public feedback. Phase 1 will be delivered this year, and then as we move forward, whether with different roads in 2 and 3, we'll continue until we're actually done with the entire project or we've run out of funds. The first project that's a little further along is the Jesus Maria. We're looking at that entire stretch. We're going to do an innovative pavement repair. It's called full depth reclamation. We actually go down into the pavement and completely remove it and grind it up, and then we add a cement additive to basically turn it into a much more stable base. We'll come over the top with a surface. With that, it should last a long time, and repairs in the future should be significantly less than what we're doing now. We opened bids last week. We got 3 bids. They were really competitive. We'll be bringing a contract to you next month for approval and hopefully construction in 2020. We have some other roads for repairs this summer: Mountain Ranch, Railroad Flat, Sheep Ranch. There's some others in there. We're looking at the JOC program to deliver that. That's job order contracting. And we're looking to deliver that here this summer. And then once we're done with that work, our road crews will begin doing the prep work for roads for 2021. The next project, this is in Supervisor Callaway's district. This is for the first of the 2017 winter storms on Murphy's Drive. This project was recently completed. The road was opened back to the public in December 2019. We are working on some final change order items with KW Emerson. We have some items we have to reconcile between each other. That process has been amicable so far, but we have some differences of opinion that we're ironing out. We may come back to the board at a later date regarding the last of those changes. But again, it's been amicable. We're working together to come with a solution. Once we're done, we'll be asking the board to approve the project, deem it complete, and then we'll begin the project closeout paperwork with FEMA. Harbor Road is our, yes.
On the Murphy's Drive one, my understanding there was some more asphalt work and barriers to be put up. Is that part of the project that was included for FEMA closeout, or is that coming under just the road projects?
Neither. There was a small amount of minor stuff on the road. There's no barriers that are part of the project. That would have been a betterment. There were not original barriers as part of the project. We do have some work to come in after the fact. We have a little bit of slope stabilization we have to do. That's part of work after the fact. We'll be doing that this summer. We didn't really have much in the way of issues over the winter that we saw. We monitored it pretty closely. So there is no plan for permanent barriers at this point. I know I've had one or two emails from the public, but at this point, from what we saw this winter, I don't see the need, at least in the short term, for anything significant. But as always, we'll be continuing to keep an eye on it and making changes if needed.
Thank you.
So the next project is Harbor Road. This is in Supervisor Garamendi's district. This project was recently bid. The board approved the contract with Coal Tuscarnia in April 2020. The permit does have some restrictions. We can't start work until this June, until next week. So we'll be working with Cole and his team to begin that project here in the coming month or so. The contract allows 30 days, but we'll get that done likely far ahead of 30 days. And again, we plan to start here in the coming weeks. The next project is Glagan Road. This is in Supervisor Callaway's district. We recently bid that project. We received a lot of bids, which was really exciting. We got a very competitive bid from a company called F. Loduca Company. Theirs is in the amount of about $363,000. We'll be bringing a contract to the board for your consideration on June 23rd to approve that contract. This one, we can legally start in June, but we've worked with our partners out there, including CCWD and the Lodge, and they have an interest in starting a little bit later. And so we're going to take advantage of that request and probably start around Labor Day, minimize the impacts, especially if it does open up to customers over the summer. We want to minimize impacts to the public. So we'll close that road around Labor Day. And then complete the repairs and complete that probably by early November of 2020.
Madam Chair?
Yeah.
I'm sorry, Josh.
Sure.
What are you going to do with the temporary bridge?
So this is it's a great question, Supervisor. The temporary bridge is currently rented. We have actually, this is the frustrating and bureaucratic red tape portion of working with FEMA. We have spent as much on rental as it would be to cost to purchase the bridge in kind. But right now, FEMA is not allowing us to purchase it. We must continue to rent it. And so when we're done with the project, the bridge will be returned to the company's called Acro. We'll be returning that bridge as part of the project. Again, from someone who's an advocate for taxpayers, it's very frustrating when you rent for something more than you purchase. But the FEMA rules don't allow you to have a betterment. So we're kind of working within the framework of that. Are there any other questions about Blagan before I move on to the next project? Supervisor Mills?
I had the same question, so you answered it, and it's kind of a sad situation.
It's very frustrating, Supervisor, and we've brought it up with both Callaway S and FEMA on at least a half dozen occasions. Try to, to put home the frustration on this, that it makes no sense at all. And unfortunately, we're not getting much of a response. I'm still holding out a glimmer of hope that they'll realize that it's still cheaper to buy it than to ship it back. But, we talked about purchasing it and using local dollars, but, with the cost of what it is, it's somewhere around $100,000. I think there's better use for that money than having a temporary bridge that may sit for years or decades and not be used. We have a lot of uses in the county. A lot of areas need attention. So it's, again, the frustrating part of working under these rules.
Mr. Pack,
Yes.
is this going to be 2-lane plus a pedestrian walkway?
So, yeah, so it's going to match what it was previously. So it's going to be 2 lanes. It's going to have a wide shoulder. There is no pedestrian pathway on this. There wasn't before, and there's no pedestrian pathway on both sides. So it's just going to mimic what's already on both sides of the road, and that's how FEMA works. You have to restore it to a condition at what it was prior to the disaster, and so. Again, we're restoring it to those conditions, which are, it's a 2-lane road with, I think, 4-foot shoulders or something like that. So there will be area to walk, but it's not a dedicated pedestrian path.
Thank you.
Okay, so the next project is Canyon View Drive. Again, this is in Supervisor Callaway's district. This project, if you'll recall, the project, when we did the engineering on it, it turned out to be quite a bit different than what FEMA had originally approved. And so we had to go to FEMA to get approval for that, and they did approve that in November. However, with that, FEMA required a revalidation of the environmental document. And so that took some time. During that time, we completed the plans. The plans are essentially 100%, and the board earlier this morning did approve the plans for that project. We were informed in mid-April that the notice of obligation, the environmental document was done, and then the notice of obligation, that's the notice that allows us to move forward, was approved. And so pending final minor edits to the project here in the next week or two, we plan to solicit bids for this here in the next couple of weeks, with construction to start late summer or sometime in the early fall. Moving on to Gwin Mine. Gwin Mine's pretty similar to Canyon View. We realized as well that project wasn't adequately scoped for the work that needed to get completed. And so we reached out to FEMA. FEMA did approve a scope change and budget increase in October, but similar to the other one, that triggered an additional environmental review. This one has design ahead of the environmental. We asked the board to approve the plans for this project in 2020. In April 2020, that was done. And by the way, this is in Supervisor Garamendi's district. The next steps, we have heard from Cal OES and FEMA. This project appears to have gotten through the environmental review process. And so we're waiting for the official approval from FEMA and Cal OES. We're expecting that here in the next week or two. When that occurs, we're ready to go. We'll advertise for construction, construction scheduled to begin this fall. So that's, once we complete those last of the projects, my hope is by the end of 2019, we will have all of the 2017 winter storm projects done. We'll have them through the final notices of completion, and hopefully in the early parts of 2021, we'll be issuing reimbursement requests to FEMA and closing these projects out and getting 2017 behind us, as well as the 2015, and then knocking some of those off the list, which would be a really good thing for us and for the county as a whole. The last ones I want to talk about here is the 2019 winter storms. It doesn't have as much gravitas as the 2017 or obviously the Butte Fire for obvious reasons, but we did have a sizable amount of damage. In total, our estimates are more than $4 million in damage. The interesting thing about this one is the federal declaration came far after the actual disaster. And usually the local, state, and federal disaster comes a little bit more quickly. This one took 3 months after the original storms, which delayed some of the repairs. In particular, $4 million is not something that the county, especially Public Works, can absorb. And so we had to rely on our state and federal opportunities to recoup as much of those costs as possible. Now, we work with different partners depending on the type of disaster. Our federal partners are FEMA and the Federal Highways Administration, and then their state counterparts are Cal OES and Caltrans, respectively. The way FEMA works is we have 3 categories of projects. Category B is emergency protective measures. Those are those things that you go and do the days afterwards to stabilize the site, make sure it's safe in the very short term, that it's not an immediate threat to person and property. Category A is the debris removal. That's pretty obvious. And then Category C is the permanent restoration efforts. And that falls under 2 categories of itself. Roads that aren't in the national highway system, that's local roads and small roads in general, small volume roads, fall under a FEMA pathway. And then bigger collector roads that are in the national highway system fall under an FHWA pathway. And so there's a lot of different processes. We're pretty familiar with both, unfortunately, after doing all of this. The one thing I want to highlight here is we can't issue a request for reimbursement until all work under categories A and B are completed. And so we are done with about 85 to 90% of the work in these categories, but we can't submit until the rest of the work is done. So category B was the emergency protective measures. That was done almost exclusively by our staff. All of that was done in the winter of 2019. There's not a lot of reimbursement here, but we did our crews were out doing a lot of man hours and labor to make these areas safe. So at this point, we're waiting for the completion of the debris removal, category A, and then we'll be moving forward with the reimbursement request. Category A, that's the debris removal. We have one project that's complete. That's Independence Road. That was completed a couple of months ago. We completed that in less than a week. We completed it well under the contract budget amount. We have two other projects. The board did approve those earlier today. One is for major miscellaneous sites, and one is for the big slide at Railroad Flat and Highway 26. You can see the sizable amount of Railroad Flat. That's the big project. There's a huge slide there, and while it doesn't affect the road immediately, the slide is unstable and does threaten the surrounding areas. The two projects, the same team that did Independence is doing the other two projects, and we're planning to complete those here in June 2020. And again, once those are completed, we can issue notices of completion and begin filing the paperwork for FEMA reimbursement. And the number on the left, I do want to highlight that $1 million. It's likely that the total amount of that's going to be considerably less than $1 million, which is going to result in a lower general fund contribution.
Question, Mr. Patrick.
Sure.
In the debris removal, are we talking about also Parrott's Ferry, O'Byrne's Ferry, and the rocks and everything that's been there?
Yeah, it's a great question. So we submitted a request when we originally submitted for debris removal. We submitted 3 requests. One was for major project sites that were going to need permanent restoration. One was for Railroad Flat, and one was for other miscellaneous sites throughout the county that just needed cleanup. And so we found out a couple of months ago that request was not approved by FEMA. The bad news is we're not going to get reimbursed for that. The good news is, though, we can move forward and start that debris cleanup. So our local crews have been going around. I know they've done some work on O'Byrne's Ferry. I know they're currently doing work on Parrott's Ferry as of this week, and they were doing some last week. So we continue to hit those off on a case-by-case basis. Some of them, all the ones that posed a hazard to the public have been completed, and now it's just doing the additional cleaning it up where necessary. But yeah, that ended up not getting approved by FEMA as part of the process.
Okay, thank you.
Mm-hmm. So the last one here is the permanent repairs, and this is where it gets a little bit wonky. We have a couple of small ones that are completed, Worden Road and Whiskey Slide. Both of those are done. One was done by our forces and one was done by a local contractor. We have a number that are in progress. We've already talked about Railroad Flat and Independence Road. Railroad Flat's big. It needs engineering expertise and a contractor to perform that work. And so we're in the process of that. Independence Road, I think under normal circumstances, under a normal load, we could probably do it in-house, but with the large amount of projects we're trying to deliver and the loss of a couple of members of staff, we're a little understaffed to be able to provide the appropriate attention to that. So we're going to consult that one out and do that with a contractor as well. Pull Station Road is a small one that can be done in-house. That requires a pretty modest effort, so we'll be doing that one in-house. We've received design proposals for Railroad Flat and Independence. We'll be approving those either through the board or elsewhere in the next month or so. And then the FEMA side of things, that's the category C for the non-national highway system. We're anticipating approval from FEMA sometime in June, and the 2 roads in that list are Calaveras and Skull Flat. So again, waiting on word from FEMA on those getting approved, and if so, then we'll move forward on the repairs of those roads. I already touched on most of these. I think the things I want to highlight here is we anticipate Pull Station. That'll be done this year. I think Independence is likely in 2020. I have to be careful, especially with the design side of things. If we run into issues, especially on permitting side or other complications, it might be 2021, but we are aiming for late 2020 on that one. Railroad Flat's going to be a while, especially with the cleanup and that huge hillside stabilization. My guess is that's going to be a 2022 delivery. And again, that's the lion's share of all the projects that we're talking about here. So before I wrap it up and open it up to any questions, I do want to highlight a couple of other things. As the board's familiar with, the issue of cash flow was a concern. The board did approve the use of RIM fees to provide adequate cash balance throughout this process. Haven't really had to use much, if any, in the way of RIM fees to this point, but I imagine over the summer we'll start doing that. Again, we're only using it when it's necessary, and we're trying to have the minimal impact on that to minimize any interest paid on that. We are continuing to aggressively pursue state and federal reimbursement, I think through the correspondence we've had here. Hopefully you're aware of, we know exactly what the process is and when we can submit that reimbursement. We've been coordinating with Calaveras and FEMA, and unfortunately, or fortunately, we've kind of found that the squeaky wheel approach has been helpful. So we're calling their staff every 2 to 3 weeks. We get a lot of updates. Most of our updates come through that. So we'll see things get moved after those phone calls. So it's working well for us. So my staff's got on their calendars every 2 to 3 weeks, call Calaveras and let's find out what's going on. And Calaveras, when we make those phone calls, has been really good to work with, and they've been responsive. The last thing I want to highlight is we recognize that this is a partnership with different departments. We continue to keep both the auditor controller and the county OES and admin involved, informed and updated of as we work forward to make sure everyone's on the same page, nothing's getting dropped. And while Public Works is pushing most of this through, there are some steps that require their assistance. So we need to make sure they're involved and engaged throughout the process. So that ends my presentation. I know I've answered some questions. There may be others. And so with that said, I'm happy to answer any additional questions you may have.
Mr. Pack, are you going to put the visuals on your website so people could access them at a slower speed than you talk?
Sure. My apologies, Supervisor.
No.
I get excited when I talk about disaster recovery.
Keep talking fast. I want to move this puppy along.
Yeah, we do have a website. We'll post it on the website. And I'll post, I think more importantly, we'll post links to that on all of our social media pages. So folks who are interested are aware and can download this update. But we do have a page that's been, these have been put on, and we'll make sure this one gets on there.
Okay, thank you. Supervisors, do you have any? Mr. Tuffanelli.
Yeah, Josh, getting back to the Blagan Road Bridge that's rented, who pays once we're done with it and we tell them we're done? Do we pay them to come pick it up, pack it up, and haul it off, and the cost to haul it back to wherever they're hauling it to?
Yeah, Supervisor Toffanelli. So we've included the dismantling and removal of the bridge as part of the contract to repair the road. And so that's included in the contract amount with FLO Duca. That is all eligible FEMA reimbursement. So the cost to disassemble it, the cost to pack it up, the cost to take it, that's reimbursed through FEMA and Cal OES with a small local set aside, but that is reimbursable expenses. So as part of this element, the contractor who's actually building it, one of his first order of business is to remove the existing one.
Okay, thank you.
Any other supervisors at this moment? I'd like to open this to public comment. Could you put our number on? Public comment. This is just an information item only. And I'm sure all of you, like myself, have Mr. Pack on your speed dial in case you have any questions. Thank you, Mr. Pack.
You're welcome. And if it's the one thing I would like to ask the board is we've been doing these, we have spaced these out a little bit. We used to do a monthly or bi-monthly. We've been going to every 4 to 5 months now. If it works for you, I would plan to come back sometime near the end of this year to provide an update, especially with the amount of projects we're pursuing to complete. So my hope is, unless the board has other direction, that we would come back in November or December of 2020 with a comprehensive update on these projects.
I think that's a good idea.
Okay.
And if any of us have questions on projects in our respective districts, we can call. Thank you.
Thank you for your time today.
Okay, I'd like to move to item 26. This will be a public hearing from the Air Pollution Control District to adopt a resolution adopting the ozone emergency episode plan. Mr. Banner.
Good afternoon, Madam Chair, members of the board.
Short timer.
Yeah. Any area
Brad.
that's...
Excuse me, Brad. Madam Chair, do we not have to recess as the Board of Supervisors and convene?
No, I've already done that because it's up at the top of our agenda that we're meeting. If you look at the top of the agenda, it's that we're meeting as all these different agencies. I already went through council on that.
Okay.
If you can believe that. I even asked council for help. But good catch. Mr. Banner, please proceed.
All right. Any area that's in non-attainment for ozone is required to have an ozone emergency episode plan. Non-attainment occurs when your area exceeds 0.1 parts per million. Calaveras County just barely exceeds that a couple times a year. And so we have been designated as a non-attainment area for ozone. Studies have shown that the primary reason for our non-attainment is due to emissions transport from the Sacramento Metro non-attainment area, from the northern portions of San Joaquin Valley non-attainment area, and from Amador County. This plan is pretty well prescribed by the EPA, and it would be triggered when the ozone level exceeds 0.15 parts per million, which it never has in our county. And it's not likely to unless there's some big disastrous thing like a fire or something like that. So there's 4 levels of it: health advisory at 0.15 part per million, alert at 0.2, warning at 0.4, and emergency at 0.5. We've coordinated with John Osborne. This would be an annex to our county disaster plan. And if there's any questions about that, I'd be happy to try. I also have Doug Carson available here for technical questions too.
Mr. Banner, have we done this before?
I don't believe so.
Okay. What is it that's causing us to do it now?
It's an EPA mandate. They're also requiring our neighboring counties to do it. Our emergency plan is virtually identical to Tuolumne's. It's just they have these mandates, and I don't know if Doug has any additional information to answer that question.
Does he?
I agree.
Supervisors, yes. I have a little. The reason that we have to do this is our non-attainment status. The EPA goes through for all various regions in the country and evaluates whether we have met the requirements for various air pollution standards. And as far as ozone goes, we occasionally don't. We're right at the bottom edge of the threshold. Because we are listed as non-attainment by the EPA for ozone specifically, we now have to have a plan per EPA regs in order to deal with that. So that's why we have one.
I mean, we've had 2 incidents in 5 years, and we're a non-attainment area. This seemed like an awful lot of work on your behalf, on Mr. Banner's, to pull this plan together.
Yeah, thank you. It was a lot of work, and I agree with you. But if the EPA says that we have to do it, then that's what I've done.
Fine. Okay, thank you. Are there any questions? Oh, there are. Mr. Stopper?
Thank you, Chair. Being our geographical area and us barely testing over twice in 5 years, as Marita had brought up, I believe I do agree with her to a certain point. It's a bit onerous in the standards that we're having to go through when we're dealing with the drift of the valley and their output more often than our very own output. But these are the requirements we deal with across from the EPA across multiple industries, and at this point, it's we crossed that threshold, so we provide the plan, and hopefully we can wash our hands of it, and we don't hit that threshold again anytime soon.
Thank you, Mr. Stopper. Mr. Mills?
Yeah, I find, especially Doug, I know that you probably put some work into it on 767 of our packet, which is the hay split back trajectories map. That's a rather interesting map to show exactly where the problem's coming from and how often. So I just hope that they don't push us eventually into yearly reporting for our vehicles, et cetera, simply because of a couple of times where we don't meet the requirements.
Yes, ozone is an interesting animal in that nothing actually emits ozone. Ozone is created by a chemical reaction caused by sunlight between things like NOx and volatile organic gases that come off, many of those coming out of tailpipes. And you're absolutely right that the drift that comes up from the Bay Area is really what's causing us our problem. We have no control over that, and yet we'll write a plan for it. Should the drift that comes up from the Valley counties affect us to that point. Just as a point of reference, the plan is triggered at 0.15 ppm. LA hits that maybe once a year. It's extraordinarily rare. And for the top level where we actually have to be worried about the amount of ozone in the air, which is 0.5, I think Beijing hit that once in the last 5 years. So it's going to be an incredibly rare situation that the plan actually happens. If it does happen, it's certainly going to be event driven. And my guess is that OES is already going to be on whatever disaster is causing the ozone issue.
It's interesting that we can't write this or charge this back to the counties and the air basins that are causing our problem, that we're having to respond to their causes, so to speak. So that's just kind of a point.
No.
I see you smiling, so you know what I'm talking about. Thank you.
Good point, Mr. Mills.
Thank you, Chair.
Are there any other comments from the board on this? I'd like to open it up. This is a public hearing to the board, to the public on this topic. Okay, hearing no public comment, I'm going to bring it back to the board, and I'm going to close the public comment and ask for action on behalf, action from the board to adopt the ozone emergency episode plan.
Sorry to interrupt. Just to clarify, Madam Chair, you're closing the public hearing, correct? Not just the public comment. Okay.
Oh, I can do both of those.
Okay.
Yes, thank you. I'm closing the I am closing the public hearing. Thank you very much, Counselor. And I'd like to have action from the board. May I have a motion, please?
I would like to move adopting a resolution or adopting ozone emergency episode plan.
Thank you, Supervisor. Is
I
there
will
a second?
I will
Second by Supervisor Mills. All in favor?
Aye.
Opposed? Passes on a 5-0 vote of the board.
Thank you very much.
Mr. Banner, on behalf of the Board of Supervisors, it's very much been a pleasure working with you, and we'll see you out on the river in your boat.
Likewise. Thank you.
Thank you, Brad.
Enjoy your retirement, dude.
Thank you, Dennis.
Item 27, integrated waste is asked to have this pulled and tabled to the June 9th meeting. Unless there's an objection, may I have a motion?
Sorry.
Mr. Mills, Mr. Stopper, one of you talk to me. Okay, let's stop. Mr. Stopper, go ahead. What?
Was there reasoning given on why they wanted to pull this item and bring it back?
No, not.
It was made by it was made by Integrated Waste.
Yes, correct.
Yes.
All right. I'll second that.
Okay, motion by Supervisor Mills, a second by Supervisor Stopper.
One other thing, Rita.
Yeah.
Is Paul on here? Is
No,
Paul available?
Mr. Alt is on here. Would you like to ask him a question before we
Yeah,
vote?
no, I would like to ask him why Integrated Waste pulled this.
There were a couple details on there that were inconsistent that needed to be updated by by staff when we were working with our contractors on this. So in order to have the item corrected, we wanted to be able to pull it and get all the data correct before we put it back on.
I just don't want to give them the opportunity to change that percentage rate up. That's all.
Yeah, that's not what the issue was. There was just some data points that needed to be cleaned up on it. So they're going to bring it back next time. But
Okay, I'm fine with that. And my second stance, thank you, Supervisor Callaway. Thank you,
All
Mr.
right.
Alt.
We have a motion and a second. All in favor?
Aye. Aye.
Opposed? Passes on a 5-0 vote of the board. Thank you. Do we
Madam
need to
Chair,
think- Yes.
Madam Chair,
Yes.
before we move to the next item, can we take a 5-minute break, please?
Yes. We're going to take a 5-minute break. You sure you don't want 6 or 7?
About 6 or 7 or maybe 10.
What would you like, Mr. Tuffanelli?
At least 5, but I'd like 10 if you can
Okay,
stretch it to
we're
10.
going to take a 10-minute recess.
Thank you.
Thank you.
Thank you.
Okay. I'd like to reconvene the meeting, please. We're going to move to item 28. It is also a public hearing to adopt the energy savings findings and approve the lease finance agreement and related documents to fund the energy-related improvements at the Calaveras County facilities. Mr. Alt, did you want to take the lead on this, please?
yes, thank you, Madam Chair and supervisors. As you know, this item has been before the board several times, and not only has it come to the board as a priority over the last few years, it's also gone to the Debt Advisory Committee and the ad hoc committee, so I won't go through the staff report and rehash all of that. I do want to introduce that we have with us Mr. Bobby Chung with K&N Financial, and he's been before us before. Just a reminder that K&N Financial is an independent financial advisor. Their job, and he can speak to it more eloquently, is to give us objective analysis of our financing that we're considering. We also have with us Mr. Scott Ferguson with Jones Hall. Jones Hall is a top firm in California helping cities, counties, and other districts with financing similar to ours. And with that, I'll turn it over to Mr. Chung and have him explain the details of the financing. And obviously, before we get too far along, we'll have opportunity for questions as well. But many of them may be answered by Bobby as he goes through the presentation.
Thank you, Mr. Chung. Yes, Mr. Ferguson, are you speaking?
I'm not speaking. I think Bobby might be on mute.
Okay.
Yeah, Bobby, you're muted.
Hi, folks. This is Bobby now. Can you hear me?
Yes, we can.
Okay, great. Sorry about that. Okay, yeah, Bobby Chung, K&N Public Finance. Good afternoon, Chair and members of the board. Very happy to be here again to talk about this project. The last time I spoke before your board a couple months ago, we received conceptual approval to move ahead with obtaining the financing, and I'm here today to report back on the progress we've made since then. As Mr. Alt said, as a quick reminder, I am a municipal advisor, and my role is to look out for the county's interests throughout the financing process. Just flipping over to the first page of my presentation, I'm really going to cover three things. First, how we selected the lender. Number two, a summary of the financing itself. And then number three, to talk about next steps. If my 3-year-old son jumps into the room, just give me a few seconds to handle that. But otherwise, feel free to stop me at any time if you have any questions. Okay. On the second slide, as we discussed at the last meeting, we worked to bring on a placement agent, which is a broker firm to help run the RFP process itself to find the lender for this transaction. We, K&N, drafted the actual form of the RFP, which includes various terms and conditions that we do not feel would be appropriate for your borrowing. We do a lot of these transactions, and sometimes lenders try and sneak stuff in, rights of set-off where they could dip into other funds that the county has. Most favored nations clauses, and we try and nip those in the bud before the RFP is even sent out. So the placement agent sent the RFP out to 25 firms. 4 responded. You see the list of the firms that responded here. Sterling National Bank submitted the overall lowest fixed rate borrowing cost, and they were selected to move on to the next step, which is the development of the documentation and hammering out the precise terms and conditions. And a full summary table of the responses, as well as the full list of the banks that this was sent to, is included in the appendix. Any questions before moving on to slide 3? Nope. Okay. This is the term sheet. It's fairly self-explanatory. At the top, you see the borrowing amount of $2.585 million. This is a fixed rate at 2.25%. You see here the basket of assets that will be leased for the financing. And I've got a separate slide that I could talk more about that later. You see the payment dates. You see the optional prepayment dates. And this is the option that the county has. So you do have the flexibility to pay off the loan at any time. At a premium of 2% during the first 4 years, at a premium of 1% in years 5 and 6, and a no premium in after July 1st, 2026. So, yeah, that wraps up the term sheet. On the following slide, slide 4, this is the sources and uses. You see the county cash contribution of $400,000 coming in, the various costs of issuance that will be funded from the financing itself. And most importantly, you see the level fiscal year payments starting in fiscal 20-21 and ending in fiscal 30. So 10-year term, 10 years of payments. And there's a more detailed semi-annual payment schedule in the appendix as well. Okay, moving on to slide 5, if there aren't any questions. Okay, this slide addresses the leased assets for the transaction. And since this is a financing structure that utilizes the county's ability to enter into lease contracts, there has to be something that is subject to the lease. Now, when I came before your board previously, we were talking about utilizing the equipment itself for the lease. Once we started digging into the transaction itself, we realized that some of the improvements financed by this lease will benefit some facilities that are already leased under the county's 2016 COPs. And so that's problematic because the investors who hold those 2016 COPs don't want any equipment that's basically subject to another financing lien. So at the DAC meeting on April 16th, we had a pretty detailed discussion about which real property assets the county has and could be good candidates for this borrowing. It was a very good discussion, and the group arrived at the following 3 facilities. The county's Huey building and 2 libraries, the Murphy's branch library and also the Arnold branch library. This last bullet point is interesting just because there's been a lot of discussion about the Murphy's library over the past couple of weeks. When doing these types of transactions, bond counsel pulls a preliminary title report for all these facilities just to make sure that there are no, existing liens that would be problematic. And this preliminary title report actually showed that the Murphy's Library was subject to an old lease that was recorded to the Murphy's Community Club. I think it was entered into like 1992, and it was worth some additional investigation. So the county folks did a lot of digging, and through a series of unrecorded documents, it became clear that the library was no longer subject to this lease. And so those documents have subsequently been recorded. And at this point, we're waiting to hear back from the title company to make sure that that old lease has indeed been removed from this piece of property. Any questions regarding the lease asset?
I have a question.
Yes.
Supervisor Toffenelli. Humberty building, you checked the background on that building and you found that it wasn't being leased right now by the county? Because I showed the Chamber of Commerce has a lease with the county on that building right now and has one for the next 4 years.
We own that building.
But it's being leased out. We own the other buildings too. And he was talking about a lease, the Murphy's Branch Library, we had a lease.
Oh, that was the land for, well, let them explain.
We have an existing lease at the Hubbard building. We are leasing that building out. I'm asking a question whether that affects any of this or not.
Yeah, Scott, are you able to address that?
Yeah, so this is Scott Ferguson with Jones Hall. We're the bond counsel helping out with this financing. We did not see a Chamber of Commerce lease on the title report for the Huberty building, which leads me to believe that while the lease may be in place, it's not a recorded lease, so it doesn't form a recorded lien on title that we have to somehow work around.
Okay, I just had to ask that question because I know it's leased out.
Yeah. So that lease will become subject to our recorded financing once we close.
Bobby, do we still have you?
Yeah.
Yes.
Okay.
Please proceed.
Okay. Moving on to the next slide, slide number 6. This is a list of documents before your board for approval. First and foremost, the board resolution approves the transaction itself, and it sets forth various terms like the interest rate and the borrowing amount, and delegates to staff the ability to take steps to complete the financing. The site lease is the document where the county leases the 3 facilities it owns to a third-party financing corporation. In this instance, we're using the Public Property Financing Corporation. The lease agreement is the document where the financing corporation leases the same 3 facilities back to the county, and then the county makes lease payments to the corporation, which are assigned to the lender under this assignment agreement. So once the financing closes, Sterling National Bank will fund an escrow account established by the escrow agreement at Sterling National Bank. And at that time, the funds in escrow are the county's and will be held in a demand deposit account, which is basically a checking account. And any interest that accrues will be the county's. This account is FDIC insured, and furthermore, any amount over the FDIC insurance limit is collateralized under a third-party custodian agreement between the county, Sterling, and BNY Mellon as the who acts as the custodian of that collateral. And this is necessary just in case Sterling goes out of business for whatever reason, and to help ensure that the county does not experience a loss. And finally, let me pause there and see if there are any questions regarding the summary of the documents for approval.
Please proceed.
Okay. So moving on to slide 7. Next steps, if we receive approval from your board today, the county and bond counsel will work over the next week or so to obtain the documentations necessary to close, and our scheduled closing is next Wednesday on June 3rd. So the rest of this presentation in the appendix, again, is the summary of the bids that we received through the lender RFP process, and also the detailed semi-annual principal and interest payment schedule. So I think I'll pause at this point and see if there are any questions overall.
Board, do you have any questions or comments of Mr. Chung at this moment? Or Mr. Ferguson?
We don't have a way to raise our hands.
Oh, hi, Dennis. Oh, you're right. Mr. Mills, please proceed.
Thank you. Thank you, Chair. If the projected cost savings aren't met, how will this affect this entire program?
So I'll address that. So the projected cost savings are our best estimate at this point in time. So we've used the current data that we can. And my understanding, Sarah can give me hers or give us hers. She's obviously the one we're relying on for this. But if we use the best data that we have and we put forward this information to the board in early years or later years in the projections, that they may move around. But we put them forward at this point in time in good faith that they're the best data available. And if the board makes findings of the cost savings at this point in time, then we can move forward with the financing should the board wish to do that. But it wouldn't negate the financing at a later point in time.
Okay, there's 3 fees that I did not see in the presentation. That's the fees for KNN, the bond counsel, and the placement agent. Do you have those numbers?
Yeah, we do, but those were originally brought forward the first presentation by KNN when they estimated the closing costs at, I think at the 95,000, which is what we came in on, those were estimated and were provided to the board in a public meeting at K&N's first presentation. I'm not sure if we have those in a slide, Bobby, but I'm sorry, I thought it. Go ahead.
It's wrapped up in the sources and uses as a single line item, but we did not break them out. Is the supervisor looking for a breakout of our individual fees?
That is correct.
Okay.
That was not the breakout was not in the original presentation.
Okay, hang on just a second. Okay, so this is Bobby speaking. I could speak first. Our fee is $35,000, and I think we've got a bit of room for any expenses if there are any. The placement agent's fee was $15,000. And Scott, the Jones Hall fee, I believe, is $33,000. Is that correct?
Including expenses.
Including expenses, yeah.
That's the maximum. And then, Bobby, there should be a line for the title.
I'm sorry, say that again.
For this title company to do the title work in the policy.
Yes, that's correct.
Yeah, because that's what I was not seeing also was the cost of all of the title work that needs to be done as well.
Yeah, yes, and Scott, I think the title insurance policy was estimated to be, I think, $3,625.
Okay. Have we done any calculation on the maintenance cost for the first 10 years?
What maintenance costs do you mean for the HVAC item?
Yes.
We actually didn't include any calculations offsets. And the reason why we haven't done those calculations is because, for one, they're new units, they're under warranty. And in some cases, the maintenance offset costs are allowable or not. I shouldn't say allowable. In some cost savings calculations, you'll see operations and maintenance cost offsets included as part of the savings. In our particular case, Sarah's opinion and what we worked from is that those offsets aren't included as part of the savings, so we didn't complete those calculations.
And are we going to be able to support the debt that we're creating here and obligating these 3 properties?
I'll use high level numbers. The debt is just shy of $300,000 per year. And the savings are calculated at somewhat over about $125,000 a year. It certainly would be the board's prerogative to direct those savings to go to the debt itself. But my position would be, from the budget perspective, is that rather than us budgeting like we did in this current year, $400,000, and potentially that escalating in the out years, that we'd have a fixed payment. And so we've already budgeted that amount in excess of that amount in the current year. So my position would be that we would be able to service the debt.
And listening to the budget discussions in other counties, as well as what the state has put forward, reduction in funding sources, how's that going to affect our ability as well to make payments?
Well, certainly reduction in any funding will affect our ability to make payments, but I would argue it would affect our ability similarly so to actually do any sort of HVAC replacements. And so in this case, it's my opinion that we're taking the safe rate by guaranteeing that we have these units as new units, rather than taking on the risk of potentially more than $400,000 in the out years. Now, the contrary argument would be, in some years we don't spend that amount of money. So in some years our debt our debt service could be more than what we would actually spend in a current year. But over the aggregate of the 10-year borrowing, we are well aware that we're going to have to replace many of these units. So we take the risk out of a year where maybe we budget a couple $100,000 but have $600,000, $700,000, or $800,000 worth of potential expenses in a particular budget year.
And I heard correctly that the certificate of participation that we have already holds leases. Do you mean the 2016 COPs? Yes, sir.
Yeah, actually, not to editorialize too much, but my opinion is that we have quite an extensive amount of properties that are committed to the 2016 COPs beyond what we needed to secure that particular borrowing. So frankly, there's some cleanup work that we need to do after this financing to make sure we're better prepared to be able to do a financing in the future if we were to consider that for the DA's building or animal services or anything like that. But yes, we do have other commitments on some of the buildings that are committed in the COPs.
I know that's a separate discussion, but I'm glad to hear you say something about extensive, because that's really what I was saying too. Thank you.
I'll be overly general, and Scott has looked at this and offered for their firm to help us with this. But here at the government center, all of our buildings are in the bulk of 2 APNs, and for the most part, those 2 APNs are committed in whole. I don't know the whole value of all those properties, but it's in excess, in quite a bit in excess of the $7 or $7.5 million we did for the 2016 COPs. So it's worth the cleanup effort for us to get properties that aren't necessary for that borrowing uncommitted from it. And that's a part that's come up in this particular borrowing that we know we have in the parking lot to do moving forward. Scott, did I articulate that well enough in generalized terms?
Yes, that's right. And there's a process property we started to look at with Al that we could, once this term financing is done, we can look back at those lease documents in more detail and figure out a way to kind of better shape the leased assets under that financing to the actual amount of debt.
Thank you, Chair. Those are all my questions.
Board members, do you have any other questions or comments you'd like to make at this time? Okay, we have received one email regarding this item. It's from Leslie Davis, the county assessor. Chair Callaway and honorable members of the board. I'm concerned that the board is contemplating the approval of debt at this time. While the board has prioritized the HVAC project and the debt advisory committee reviewed and recommended the financing terms, those actions occurred before the impact of COVID-19. Stay-at-home orders could be understood. Indeed, your next agenda item is titled in part, Fiscal Uncertainty Facing the County. I doubt that anyone has a clear picture of the financial future. I am a member of the Debt Advisory Committee. I'm also a department head who's been through budget cuts for several years. I'm not willing to continue a recommendation that would put debt service ahead of employees. I do not think you should either. I respectfully recommend that you reject the financing agreement and consider the alternative of funding critical aspects of the project through general fund dollars. Are there any public comments coming through?
Madam Chair, can I speak to that one really quickly?
Yes.
Ms. Davis did reach out to me very respectfully and let me know what her position was that she's expressed in the email. So I wanted to make it clear that she was upfront and letting me know her concerns. I would say that our auditor controller shares those same concerns, and I appreciate where they're coming from. And did convey as we move this forward that I would express the concerns if she didn't already put them forward publicly. I know it's a different time than when we started this, so I appreciate that she's provided that information to you. But as I committed to her, I would have spoken to that as well. I know there are some concerns now on where we stand on our financial future compared to where we were when we started this process.
Okay, thank you. I will ask if the auditor controller wanted to make any comments.
This is Kathy. Are you able to hear me?
Yes, Ms. Gomes, we are.
Okay. I actually agree exactly with where Leslie is coming from, as I have worked a bit with Krista in admin to come up with projections. There are some really big uncertainties, and for that reason, I also would like to suggest that you at least put this item off until after you get to preliminary budget.
Okay. Thank you, Ms. Gomes.
Thank you.
Are there any calls coming through on this item? We'll wait a moment.
Madam Chair, if I might, I appreciate where our auditor controller is coming from. She's been very consistent on her messaging and thoughtful about what she's put forward. One of the things that I want to mention is our rate lock through Sterling National Bank. Because of what's been a really dicey rate environment, we can't necessarily promise, and they haven't promised to us that they will maintain that rate out past the June 3rd date. In many cases, I'll let our finance folks speak to this far more eloquently, but in some cases, some of the experience they've had since the COVID outbreak has been that banks wouldn't guarantee their rate for more than 48 hours because it's such a dicey market for them. So I do appreciate where our auditor controller is coming from on this, but with respect to the financing, my own opinion is that the board make a decision to go or no go today, or we introduce a whole new dynamic in the rate market that may not be best for us. And in some cases, it could be better for us, but it creates risk in the project where my own opinion, and certainly we have professionals here on the line that could share their own, is that if the board's not of the mind to move it forward, that it's the appropriate time to table it and just move on at this period of time rather than carry it out for another month or so.
Thank you, Mr. Hall. Okay, is there nothing coming in? With no calls coming in, I want to close the public hearing and bring it back to the board for any comments and action. Do any of the board members have comments they'd like to make?
Mr. Callaway?
Yes, Mr. Stopper.
We've been working on this for quite a while. I do recall those numbers coming up from the initial presentation on line items that have been presented to us, and they've been for the most part consistent moving forward. And I'm glad that they work forward to address the lease issues to the best that they could as things were filed. To the Leslie Davis and Ms. Gomes issue, yes, we were doing this before COVID, and COVID's a health and safety issue. So is making sure that we have proper environment systems within these buildings for the safety of our employees, and that's putting our employees first. Is we don't need to be putting them in environments where things are breaking down, and especially with the summers here being in triple digits. With that, I also, we've heard testimony from Patrick, on our keepings of our grounds and working the maintenance. Many of these aren't even going to start up this summer, and if we keep kicking the can, it's going to only cost us more in the future, as we found out with many other projects in Calaveras County. So, with that, I see that there's multiple members of the board that have more comments, but I would like to consider a motion once they're done conversating.
Thank you, Supervisor Stopper. Mr. Mills.
Yes, thank you, Chair. I got to agree with our auditor and our assessor, and Madam Chair, you also and Supervisor Toffanelli went through the 2010. So you know what that was like. And with the budget uncertainties that we are facing, I think until we have an actual chance to sit down and have that budget discussion and get past the end of June, it's going to be very difficult for us to deal with the unknowns. I'm not in any position to support something like this until we see the full picture of where our budgets are going to land over the next 12 months. So I will just leave it at that.
Okay, thank you. Mr. Garamendi.
Madam Chair, I think you are muted. You're still muted. There you go.
I'm sorry, Mr. Garamendi.
Thank you very much, Madam Chair. I am the king of baling wire and duct tape. So I think I've got some experience in keeping things going. But there's a certain point that you have to replace things. And this is a can this has been on the agenda since as long as I've been on the board. We need to do this. Sometimes that car you just can't fix anymore and you need to go out and replace it. We have beaten these numbers to death. I believe that this is a good business decision for the county and our physical plant and our employees. And when you're prepared, I'm ready to second this motion.
Thank you, Mr. Garamendi. Mr. Toffanelli?
Yeah, well, those are good. Supervisor Garamendi and Supervisor Stopper, I certainly understand where you're coming from, and they're very valid and good points. However, being a businessman myself, I have been shut down for the last 6 weeks. All my employees are home waiting to go back to work. I would not consider at this time going into debt. I just don't know what is going to happen in the future, even if we do and when we go back to work. It just doesn't make sense. Even my personal finances, if I got laid off of my job and didn't have a job, I wouldn't be looking at going into debt, whether I needed a new car or not. I certainly can't agree more with our auditor controller, who sees the revenues coming in and going out, and Leslie, who provides the assessments for all our real properties in the county, and what they foresee happening to us right now with this COVID-19 pandemic situation. I find it very interesting that this item is before the next item. It seems in progression, the next item should have become before this one. So we had that at least peek into what's going on. Even this item should have been, in my opinion, carried at least until June 9th, which is when we were going to have preliminary budget coming to us. So we have a full understanding and knowledge of exactly what we're looking at coming forward. I asked Mr. Alt that where are we in the projected coming budget with teeter funds? Have they been all expended for the next budget? And have we had any of the general fund departments affected by the coming budget? Are they being asked to do any reductions? Are we looking at reducing staff in any of those departments for any deficits that we may be facing coming forward into our next budget year? With all of that in doubt, I'm asking that we at least put this off till then, or we table it, but we do not go forward.
Mr. Tuffanelli, it was my decision during agenda review that we put these two items together. It was not staff's decision, and I could have done it either way. I happened to choose this way. So for me, I am going to be supporting this one.
I still find it very interesting that the next item has to do with less going in.
I understand that. I understand that. And maybe in retrospect, I should have done the other item first, but I chose not to at agenda review. I'm going to be supporting this one. It's been discussed for many years. I, as Supervisor Tuffanelli has, and I'm assuming Mr. Mills and Mr. Garamendi have been through many budget cycles, and we'll say, well, let's wait, let's put it off, and let's see what happens next year. And next year comes and we don't know what's happening, so maybe we'll, as Mr. Stopper said, kick the can down the road again a little bit more. And considering that we're going to have to either budget at the last minute or something happens, this does deal with our facilities. The HVAC system that we have is pretty much as old as the government center, and we need to make the investment in the infrastructure in county government, at the county government center. So even if we waited, then we might lose out at the 2.25%. And that's pretty good rate for commercial businesses. I heard what Mr. Tuffanelli said about being a business and borrowing money. I've talked to some local businesses in my district who did borrow money through the CARES program, and they are investing and they know it's a loan. So, we can always find a reason to move it out. And I am very sensitive to the budget and its relationship to county staff and to services. But it's like why we don't have an animal shelter. We keep pushing it down the road, and at some point you just have to say enough is enough and we need to move forward. So based on that, I am going to support this and all the documents. Mr. Tuffanelli, since I talked about you, I guess you can have another moment or two.
Thank you, Madam Chair. You did talk about me, and the CARES program we're not discussing here. We're not getting the money from the CARES program, which you can have them wipe out the debt of your loan if you go through certain things that you need to do. But I also want to make one other point, that in the information that was presented to the board today, Mr. Alt, I have a question for you. The May 7th ad hoc committee meeting, is there any minutes to that meeting? Do we have any documented minutes for that May 7th meeting?
No, we don't take minutes from any of the meetings, so that's just direction from the ad hoc.
Okay, well, if I recall that meeting and I was present and you gave us the new findings, savings, I don't recall ever taking a vote saying that we would recommend this to the board. As a matter of fact, when you asked, I said, I need more time to go through this. You just handed it to me 10 minutes ago before I agreed to any of it. But yet it says here that the ad hoc committee recommends the board adopt these. I don't recall ever having that conversation. So my recommendation is not that this board adopt those. So.
Okay. Well,
thank you, Mr. Tuffanelli. Are there any other comments or questions from the board on this item? Okay, I will take a motion. I believe I heard there was a motion from Supervisor Stopper. Mr. Stopper, does your motion still hold?
Yes, ma'am. I will make a motion to adopt energy savings findings and approve lease finance agreements and related documents to fund energy-related improvements to Calaveras County facilities.
Mr. Garamendi, does your second still hold?
Second.
All in favor? Aye. Opposed?
No.
Passes on a 3-2 vote of the board with Supervisor Mills and Supervisor Tuffanelli in opposition. Thank you. I'd like to move on to item 29, which is the administrative presentation only by the administrative office on the fiscal uncertainty facing the county for the board to consider in anticipation of the 2021 budget hearings. And Mr. Alt, could you please remind the board of the dates for our budget hearings?
I can. And the budget hearings will be June 9th to June 12th if needed.
Okay. Thank you. Please proceed.
So I'll give a quick introduction, but Krista will be handling the balance of the presentation. This isn't typical. We don't normally give you a preview of the preliminary. Typically what we would do is just bring preliminary during the budget hearings and give you an idea of where we're at. But under the circumstances and with the presentations that we've heard and seen from other counties, we wanted to make sure that the board had the clearest picture that we could have at this particular time. And so our colleagues in the departments could also hear what our projections are at this point. So for the most part, in summary, I'll tell you that our recommendation is going to be to keep a very flat budget. You'll see that we do need to have some reductions. I would characterize them in the areas where we can handle them for the most part through reducing discretionary spending and being very cautionary about our hiring and what I would term a hiring chill. But in general, right now, the data that we have for the revenues that have come in through the current year and as we project out, don't give us the same pause that you may be seeing in Tuolumne County or some of the other sister counties. But with that as a short introduction, I'll go ahead and hand it off to Krista, and I'll thank her for all her hard work. She's been really the lead on the budget, and it's with Tony and Barbara and our colleagues in the Auditor Controller's Office, it's a very heavy lift, especially when got some of these other projects coming forward and a pandemic overlaid on top of that. So Krista, if you could, and if you can share your screen, please.
Yeah.
To show the presentation.
Yes.
This is Supervisor Mills. Will her presentation be available to us in a format of some type beyond the meeting? Because it wasn't on the agenda.
Sure, I'm happy to provide that.
Thank you.
Okay. Good afternoon, Madam Chair, members of the board, Krista Van Lotta from administration. Let's see here. So by way of overview, we've got the goals of the presentation to discuss with you, the budget landscape, our projection for the remainder of FY 2019-20, the recommended budget overview for the coming fiscal year, projected revenue reductions, projected revenue increases, unknown factors, potential discussion, or potential solutions rather, and then board discussion. So in terms of goals of the presentation, what we would like to do is give you a budget overview. It is not intended to be a quasi-budget hearing as much as to just kind of set the stage for where we are at and where we may be going as we begin to move through this budget process. We would like to give you our strategy and inform you of that. Hence, this is an info item. We're going to present the potential issues, posit the potential solutions, do some Q&A, which we're happy to answer to the extent possible. I do want to note for the board that many things we may need to wait to revisit at the budget hearings and certain information that we won't have even necessarily at that time. And then hear the board's discussion. So in terms of the state landscape, the governor's May revise did include substantial budget recommendations that have been modified. We see the CARES Act funding, most of the January proposals rescinded, the state borrowing from special revenue funds, and other reductions. So in terms of Calaveras County, as of March 30th, we directed departments to use certain mitigation measures. So these included an open position chill, not a straight across the board hiring freeze, and to cease discretionary spending across all of our categories for the most part: professional services, supplies, travel, facilities, CIP not previously designated by the board as a priority, and fixed asset purchases that were not already subject to a purchase order. And that direction was given in writing to departments on March 30th. In terms of where we think we're going to finish out this current fiscal year, administration and the auditor controller's office work closely to come to a general fund balance projection as of June 30 of approximately $3 million. That would be down from approximately $5 million fund balance coming into this fiscal year. Just by way of history, the prior fiscal year, we closed out when we finally had the year and close and numbers in August at about $3.3 million less than we had in the prior fiscal year, 2018-19. General revenues overall are on target. We see salary savings, which we're projecting at approximately $3.4 million, and that is already included in the fund balance projection of $3 million. And we are not anticipating a teeter transfer to balance. So our overall budget message for fiscal 2020-21 is to do a status quo budget with a 5.3% reduction to balance. The budget is balanced overall. Reserves are above board policy level at 10%. Sorry, I can't quite see mine. There we go. 10.64%. Contingencies are at the board approved policy level of just over 2%. General fund reserve will be at approximately 5.4 million. So we have made what we believe are very conservative revenue assumptions. Our message to the board at this point is, other than the 5% reduction, 5.3% reduction to balance, that we essentially stay the course at this point with our conservative revenue assumptions. And then when we have more information and the books are closed or about to close in August, do a study with session with the board in mid-August at that point and revisit with the additional information that we have at that time, and then to make adjustments for the adopted budget in September. So the budget includes expenditure reduction of approximately 5.3%. And this is of the general fund contributions to balance of approximately $1.85 million. Of note is that they are budgeted as salary savings. However, the reduction is general and is not intended to be necessarily a reduction in salaries and benefits. And we will work with the auditor controller's office to move money between services and supplies, for example, and salaries and benefits, or vice versa, to the extent that departments need to do that. Projected fund balance used to balance was that $3 million that we discussed. Budgeted teeter transfer to balance of approximately $6.7 million. The contingencies would be, at 1.5 million, and general fund reserve at 5.4 million. So in terms of what we projected down for revenue, sales and use taxes 25% from last year's budgeted amount. not the actuals. Prop 17, that's an $825,000 approximately general fund reduction. For Prop 172, a 25% reduction from last year's budgeted amount. So that is $475,000 less revenue projected, 427,500 of which is general fund after 47,500 to fire districts. The TOT, we're projecting a 50% reduction from fiscal year 2019-20 budgeted amounts. So that's a $747,000 and change reduction overall, with half of that, or about $374,000 in general fund reduction after the $373,000 or $4,000 to the Calaveras Visitors Bureau and the fire. Other revenues, so not property tax, not VLF, not all of the fees, tobacco settlement, or the PG&E franchise fee, but in our general revenues budget unit, we are budgeting at a 33% or a third of last year's budgeted amounts, a reduction over last year's budgeted amounts. In terms of projected revenue increases, the administration worked with the director of the Division of Cannabis Control, and we were advised that about 1.1 million, which is budgeted at 60% of what the low estimate is, pardon me, is what we have budgeted. And upon the advice of the Office of Emergency Services Director Osborne, with respect to the disaster budgets, after they had an opportunity to work through those budgets, believe, and we did budget approximately $2 million in Butte Fire revenue recovery.
Stuff on that last slide.
Yeah.
Are these Butte Fire, the approximate $2 million, are those things that they've closed out, that they've already been through the process and approved? They just haven't received the check yet from the state per se?
I would defer to our OES director, but I think I believe it is accurate to say that they have been, or they have been closed out from our perspective. At which stage they're at on the other side, in terms of FEMA or Cal OES, I would need to defer to John, but that is my understanding.
Thank you.
So here we go, unknown factors. So COVID-19, I think that speaks for itself. Economic recovery rate, we've heard about the V-shaped recovery, the U-shaped recovery. We just don't know. California budget impacts, we are still early and kind of ascertaining what some of those might be. Collective bargaining, COVID-19 federal and state relief, and quite frankly, will there be a revenue backfill at some point? We're aware that the HEROES bill is likely going to be discussed in the Senate. I don't know what the practical, I don't know what's going to happen with that, whether it's that particular bill or a different bill. The real true issue for most counties is going to be whether something becomes available to backfill lost revenue, as opposed to expenditures that have been made directly as a result of COVID-19. Local business impacts, unemployment, how long it will take our tourism industry to recover, and then other unknowns that I either neglected to include here or just haven't really risen to the surface of the conversation yet. So potential solutions from a revenue perspective, we can expand contract services where available and work with departments to see whether there are opportunities there. We could present a sales tax increase to voters. We can focus on heightening our TOT compliance and trying to do some revenue recovery in that arena. We could focus on fee studies. and potentially increasing some of our outdated, or decreasing as the case may be, some of our outdated fees. We could expand the cannabis program and include them within that program, UO permit holders who owe back taxes, contingent obviously upon the back taxes being paid. I understand that there is quite a bit of money left that we're owed, so that would be an option. In terms of potential solutions with respect to expenditures, clearly these are all difficult things to contemplate. Ceasing non-mandatory services, examples of that would be our economic development department, the county library system, public access television. We could reduce programs to minimum mandates. Again, that would be something that we would need to visit with departments individually in order to bring back specific recommendations in that regard. We could revisit the TOT methodology by which roads, the Sheriff's Department, the Calaveras Visitors Bureau, and fire all receive 25% distributions. At least that's how it was budgeted in this current fiscal year for the budgeted amounts. And we could revisit county contributions or community organizations, some of the funding that that we basically give away to some of our partners and whatnot in the county. Some of that is by MOU and other arrangements, for example, the TOT. In terms of expenditures, also labor-related reductions. So a hiring chill, that's in progress. A hiring freeze as opposed to a chill where, and this is somewhere where board direction would be critical for us, because in certain universe, for example, if health and safety were to be segregated out and to freeze other departments or other positions in the county, a salary cut, furloughs, layoffs, other potential collective bargaining concessions. And I wish to note here that we at the administrative office fully expect ourselves and will look at these should we get to a point where something like this is necessary. We will look first at ourselves. So I will do my very best to answer any questions that you might have, and look forward to hearing discussion amongst the board members. CAO Alt, is there anything that you would like to add?
Not at this point. Thank you, Krista.
Mm-hmm.
Madam Chair, you're muted. Thank you.
I'm trying, all I can see is discussion, so.
Oh.
Pardon?
Let me stop.
Oh, she's screen sharing. Thanks.
Sorry.
Thank you very much. Understanding that this is the 10,000-foot view of the budget, and we haven't seen details. Do any of my colleagues have questions or comments they'd like to make at this time? Krista, you did a great job. Oh, I know it. Got it. Mr. Mills.
I was waiting to see if I could get anybody else to raise their hand first, but that didn't work.
I was just about to close the meeting.
It was pretty obvious that the CARES Act, large cities and counties scooped up the majority of it that was appropriated to California. We did see some numbers. Krista, do you have any numbers on what is projected from the CARES Act for Calaveras? Was it like 600,000 or something like that?
You know, I am not confident about this number, and this is definitely something that, as we obtain more information, we will be advising the board of to the extent possible. This is definitely something that we'll want to revisit at our budget hearings. I have seen an estimate from RCRC, and if I'm reading it correctly, it's a pretty large number, but as I understand it, it's to reimburse counties for direct COVID-related expenses. Now, I could be wrong about that. This is premature. I truly apologize that I don't have better information for you on this, Supervisor Mills.
No, that's fine. I'm not trying to put you on the spot there because I had kind of heard the same thing, and I was very concerned that we would try to figure that into our budget, and yet it may not come to pass. I've also heard something about potential realignment. Have you heard anything along those lines as well, much like to 2010?
So if you're referring to the 1991 and the 2011 realignment, I can tell you that all departments are looking at that with respect to Health and Human Services. They've done a very deep dive. Probation has done a deep dive. And, you know, it depends on the particular funding source. And I look forward to Kristen being able to give us more information when we get to the budget hearings. But having looked at her 3-page memo, it goes from status quo with fiscal year 2019-20 budgeted amounts for certain programs to a 13% cut. So, and there are a variety of different places. Then again, they're also retaining other funding that is related to COVID, and that, you know, as you've had Ms. Stranger has communicated to the board, an example of that would be Project Room Key and other such expenses. So we'll have much more information from Health and Human Services for you at the budget hearings.
So the question then would be, in closing out our disasters, how quickly are we going to be able to get a turnaround on COVID-related expenses or closing out our disasters? Because I was thinking one thing that wasn't discussed is the true mortality. Are we done with that? Have we gotten all the funds back on it, or where are we at financially with that one?
So we have regularly been receiving revenues on tree mortality. I did not pull those exact numbers this morning, but as of the end of last week, we had actually received more revenues than we had made in expenditures for that program, and we are not projecting to need to transfer any of the $300,000 that's currently budgeted out of the PG&E money. The budget request for next year for that department will include much smaller requests from PG&E funds in order to get that program closed out. Again, I defer to Director Osborne and would like to revisit at the budget hearings if you'd like more information there.
I think we really need to know on all of the disasters how much money is yet to come in, or that we've committed out of our budget that is yet to be returned, and at what point that will come back to us, because that will have a big effect on our cash flow. The 6.7 million in teeter, I question how many years could we take 6.7 million out of teeter and still keep a reasonable teeter fund?
Theoretically, if we were actually to have to make that transfer, we would not have a teeter fund left unless we had additional revenues in that year to offset it. However, it's important to note that the budgeted transfer is for the point of balancing our budget, like this year, where we don't, the auditor, controller, and I think, I know this is part of where we came up with our closing fund balance projection. We do not anticipate making any teeter transfer to close the books this fiscal year. So we know that we have revenues budgeted and we have expenditures budgeted that don't always get realized. And so the hope would be that this is on paper, so to speak, as opposed to something that would actually come to fruition.
Thank you. You know, it's kind of interesting. We just, the previous budget item talked about creating debt. I didn't see anything in our discussion here today about debt service in our budget.
That is correct. There is nothing in the PowerPoint with respect to debt service.
Because I think we need to know what that debt service number is overall for everything that we're doing here, because it will have an impact on our ability to meet our obligations.
Okay,
And
understood.
that's all I have for now. Thank you, Chair. And thank you, Krista.
Thank you, Supervisor Mills.
So that debt service question, does that sound familiar? Yes. I agree with Supervisor Mills on that. Mr. Stopper.
Thank you, Ms. Chair. I had a webinar meeting with multiple county supervisors across the state, and we were talking about different issues, especially when it came to budgets moving forward. And I do appreciate you bringing one of these study sessions per se forward to us to update us prior. A lot of counties have already proactively had this meeting elsewhere, and I really think it's pertinent to stay updated as we move forward towards the fiscal year budget. With that, you know, a lot of the same issues that we're dealing with are very fluid and could go one way or the other as we proceed, depending on how fast California opens back up and also whether there's another wave moving into the future, especially when it comes to our TOT tax. Talking to people from Placer County and South Lake Tahoe area, one fortunate thing for us is, yes, we did miss part of our ski season, but a majority of these this time we spent throughout this COVID experience is the off time for rentals. So you know, looking at the overall picture as we move forward, it is contingent on when the state opens back up and how long that lasts on those. So with that, you know, we do know there is a loss. That percentage could go up or down. I personally, if there were any direction to give, personally, from my perspective as one, moving forward with something in the effect of a chill on hiring and looking at possibly too, you know, if the percentage grows, then possible freeze with a juggling of resources so that we can keep pertinent services open as we proceed. You know, with that, you know, I would also like to see this PowerPoint or, you know, what you have here, Krista, sent to me also. You know, and anytime that you're able to update us as you're proceeding, I would like to be able to read the stuff earlier if possible, just for the fact that when we go into the budget, you know, we only have like 3 or 4 days with a 700-page binder. And, you know, I would like to get a little front work on that stuff. You know.
Understood. Well, we are aggressively trying to get the budget book published as quickly as possible. As a practical matter, the end of this week or sometime the beginning to middle of next week is when we expect to have it completed. We are in the midst of our budget book development now.
Very good. Thank you.
Mr. Toffanelli.
Yeah, I just wanted to add what Ben had to say, that can you please forward your PowerPoint to all the board members, Krista, so we have a chance to look at it. And then as soon as we possibly can get any information on June 9th meeting, we can get that forwarded to us, because Ben's correct. Usually we only have a few days to look at and try and digest everything in the budget. So
I can send a link when the budget is posted to the board.
Thank you.
Mr. Mills, did you have something?
Yes, please don't send me a link because I can't put my feathers on email pages. So I do need a hard copy to work with.
We'll have hard copies as well. Okay. It might take us an extra day or so, but
you know, just an old gray hair that just doesn't want to go that way yet. Okay. Thank you.
And no, I actually completely understand them the same way.
Well, bookkeepers, believe it or not, accountants or bookkeepers, they like it in hard print. You know that as well as I do. So thank you.
Any other comments from the board? CAO, did you have anything you wanted to add to this? Don't feel obliged.
No, I don't.
Krista, on behalf of the board, thank you for this overview. From my behalf, I was not as bad as I anticipated. It seems like, you and administrative and county departments have already started your due diligence, and we appreciate that. Thank you. If there's no further comments from the board on this item, we'll close that and move to, oh yes, thank you. Are there any public comments on this item? I have to get that. Those public comments that Jack gave me. Yeah, Marita, public comment. Okay, I'd like to bring it back to supervisor announcements. Do any of the supervisors have something they would like to address? Well, I do. Well, Mr. Mills, you can go ahead first, please.
Are you sure?
Well, no.
You started. Go ahead.
Go ahead, Mr. Mills.
Well, if we end up going into physical meetings again in the month of June, and it stretches into Thursday, June 11th, we'll be possibly in a conflict with the Planning Commission. Just kind of keeping that one in mind. Okay.
We'll just move planning. We'll just move the Planning Commission out to the Mechanics Building.
Okay.
Mr. Stopper.
Thank you, Ms. Callaway. I've had multiple meetings. I brought up a little bit of just a non-reportable meeting I had with multiple supervisors discussing a lot of things, a lot of good ideas coming from everyone. We all have a lot of, hard decisions and a lot of work in the days coming forward to work through. I also last week had a solid waste task force meeting. We discussed, the item that we pushed forward today. So we'll be back to that. We also discussed expansion of the cell number 3. We have some more work to do with that. And then also we're having a county council check into some of our assessed taxes when it comes to developed property fees that we may be able to work with in the future. I also had a CSEDD meeting, with the economic development group. A lot of good work going in. Primary conversation: COVID-19. What are the impacts? How is everyone moving forward? And a lot of more good input. Just like with our peers from other counties. And also the muzzleload job training. board met last week, and same issues with CSEDD and everything. One of the big issues is with some of our industries, as we move forward, some areas may not be opening up where others will, and backfilling some jobs, such as, let's just use the National Forest as an example. If we want them to patrol their areas in certain circumstances, it's going to be hard for them to up their levels in staffing, especially if staff comes from out of state from another area, and they may have issues getting to the area because so many employees for those type of jobs are satellite out. So just some things in our unique times that we're going to have to deal with moving forward. That's all.
Thank you, Mr. Stopper. I have a challenge for each of us. The census response from Calaveras County is at 32.9%. That doesn't bode well, it doesn't help us. So we'll each need to take an active role in trying to get people to complete the census. Thank you. It says, his face says Calaveras Census 2020. I wear mine too. Mine's lime green. Part of it is that 88% of our residents get their mail through P.O. Box, and the census does not send to P.O. Box. We had about 9,000 pieces of mail returned just in District 3 alone, because it went to physical address versus P.O. Box. And the only reason it got to be returned is because it was first-class mail. The census takers are supposed to possibly start next week. Some of them are concerned about doing it because of the virus. So, excuse me, the anticipation is that we will lose some of the census takers. They need census workers. They need some in the West Point area and in the upper Highway 4 corridor. It could change. They might start doing tabling in front of stores with iPads and so forth. But we definitely need to improve the number of people who respond to Census 2020. It has a significant impact for Calaveras County. So I challenge myself and all of you to try and get people to sign up. CAO Alt, do you have anything?
I do not, Madam Chair. Thank you.
Council?
No.
I will ask my helpers here. No. In the boardroom, do they have anything? Susan, do you have anything? No. Thank you. Thank you, colleagues, and thank you, IT, for putting us together again. See you all on June 9th.
Good day.